fourth seminar on best European practices. And thank you very much for coming, both for those of you who've come here and have joined us in situ. But I'd also like to welcome those of you who are following us from elsewhere, Latin America, also Chile, etc. So warm greetings to all of you. The speaker is addressing the audience in Basque, for which there's no interpretation, but will remain in standby until she resumes with Spanish. These are just some greeting words and welcoming words. This event is organized in the framework of Euskadi Lagungoiak from the Department of Justice and Social Affairs of the Basque Government, a project that's made up, that's been taken on by a series of municipalities, towns, cities, many of which are represented here by many of you. The idea is to reflect upon the challenges and needs of municipalities, towns and cities in order to adapt to the aging process in this context of restrictions brought about by a COVID crisis. We also want to share innovative and transforming experiences here and elsewhere in order for them to be implemented in the Basque context. And I would also like to share the different awards given to awards. This event is going to be carried out in Spanish and English. Those of you who are following us know that you have to click in the link corresponding to the language you're interested in, that is English or Spanish. So without further ado, I'd like to invite up to the stage Mr. Juan Ibarretxe from the Town Council of Bilbao in order to open this seminar. Good morning, dear friends. Good morning, all of you. Prior to starting with my presentation, I'd like to convey to you greetings from the Lord Mayor, who would have wished to be here, but he's recovering from an operation, from surgery, and this is why hasn't been able to attend. It would have been extremely interesting to listen to his opinions and reflections, because he's being a true leader in this COVID crisis, and he is at the lead of search for solutions to the pandemic and its consequences. A seminar was held in order to consider the different possibilities, such as coordination in order to prepare the city for the possible new crisis situation. We could spend hours analyzing what we've set up in Spain, in the Basque Country, rather in Bilbao. So I think this seminar is very timely, because we're going to be approaching different cases and examples from the Basque Country and the rest of Europe. We can all learn from the different messages and ideas that will allow us to be in a better position to approach and address similar situations in the future. I'm sure that the conclusions you'll be reaching will be fruitful and extremely important to have a better prepared city. In the Basque Country, we became aware of generating interconnection links that on an institutional level in order to provide a comprehensive response as a country through coordination between public administrations and third sector entities. We came up with different programs. using COVID funds and making a shared program and project with a task force and several task forces that worked right from the start in an efficient manner with people very committed, people whom we would like to thank. And I would like to highlight social action areas, citizen protection, health, without forgetting the cooperation carried out with third sector entities. The priority was to protect everybody without exclusions, without excluding anybody by means of an early intervention. The effects of COVID have generated a health care crisis, socio-economic crisis, and educational crisis that is affecting our lives, but especially people, the most vulnerable groups of people. Institutions have had to adapt their services. As you know, Bilbao is a friendly city. It's friendly with the elderly, with children, with adolescents, with the more vulnerable. And this is the promise on which we work. We are focusing on people and their needs. Municipal social services, thanks to the Basque protection system, are developing specific interventions for prevention, early detection, and assistance and care for people at risk. People like the elderly, women, members of destructured families without income, migrants, or homeless. This extraordinary situation derived from lockdown meant a readjustment of our services and priorities, and this made us make urgent decisions due to the situations that were being generated. But this also provided us with the opportunity to introduce hope by seeing that a new window, new times were coming, looking for new alternatives and new intervention strategies through more comprehensive responses. And an example of this was the so-called coordination groups with all the involved stakeholders by sharing everybody's resources, by sharing material resources, capacities, experiences, know-how, and well-doing. And I'd also like to highlight the coordinated work of the Town Council of Bilbao with education and healthcare units and sectors. Different things have been done in order to bridge and to do something about the digital gap, making sure we could help those people under exclusion. I'd like to share with you a series of brushstrokes regarding the main actions we carried out since the start of this healthcare crisis. In this situation of alarm, it was important to take care of the people, but also municipal services and workers in order to care for citizens. We had to reorganize services, spaces, intensifying the coordination of professional teams in order to ensure an optimal care. And as regards interventions, I'd like to highlight a few. This situation has directly affected the elderly. Non-desired loneliness has and is still one of our main concerns. In order to know the healthcare status and how older people were feeling and what their non-met needs were, we set up, we made 36,000 calls to elderly people. We also organized different centers We have been given urgent income in order to prevent these situations. In those services which, because of the situation, were not able to keep on operating, day centers, carers, etc. We did a telephone follow-up in order to keep in touch with all the people and in order to satisfy their needs. Minors and their families have seen their contacts intensified in order to take care of adults in the families and also keeping psychosocial aid to more vulnerable homes. We made sure that the digital gap wouldn't be the cause of more exclusion. We organized leisure activities in the family, turning homes into a space that would strengthen families. Adults risk of lack of protection, and because of the effects of this pandemic, this has made us set up a telephone care and services, especially for vital services. With the lockdown, those families under an unstable situation saw how their income disappeared and found it difficult to survive, and this is why we had to come up with different services in order to provide these urgent aids and all these aids were possible thanks to the extraordinary funds provided by the Basque government. And Leseburu led the management of all this. And finally, I would also like to highlight the care given to the more vulnerable people in the city. The Town Council of Bilbao established a system for homes and spaces in sport facilities, in also homes used by municipal services, and day and night services were provided, thus covering basic needs such as food, dressing, healthcare. At the end of the lockdown, 336 people had access to temporary housing through the Lenuracha project, a project that was managed by means of close cooperation between the third sector, Basque government, and the town council. Thus, we made it possible to provide services or projects that favored social integration so we expect 5 conclusions from all this. Interinstitutional cooperation between the third sector and private companies is essential in order to provide a more efficient response, thus taking care of the most vulnerable people. Social services have been considered as essential, and during this state of alarm, we've seen that direct care and direct attention is even more relevant. Being able to respond to these situations has made social services focus on covering basic needs, but ahead of us, we still have the challenge of recovering the community intervention spaces as areas where we guarantee the sustainability of life projects of people, thanks to intervention and cooperation in families and with the elderly. We've been able to provide new answers, agile, innovative answers adapted to these times, and cooperation with different welfare systems has allowed us to take care of those people who are having a tough time. But take into account the situation brought about by COVID, we have to move quickly. We have to reorganize all our services. As I said at the beginning, this situation has made us share and exchange all our tools and best practices in order to anticipate problems and to provide quick solutions. Strong leadership like that of the Basque president have been key issues in order to be able to do all this. And now we may wonder, what are we going to do? So we have the challenge to tackle the economic and social consequences of this pandemic's transcendental challenge, but at the same time, an opportunity. Coordination, collaboration, responsibility, solidarity, and a lot of work the service of citizens are a key during this crisis in Bilbao, a city that's friendly with its people. Thank you very much for your attention. Thank you very much, Mr. Juan Ibarretxe.
berrantolakuntza eta elkarlana. Y ahora tiene la palabra.
I'd like to hand the floor over to the Regional Minister for Social Affairs. Good morning. For me, it is an honor and a privilege to be here with all of you. This hard situation has changed our ways of living, of relating to others, and of doing things. And organizing seminars like this one is a step forward on the path that we have to cover together. And I think that, yes, the situation is difficult, but holding events like these and making use of new technologies that allow us to get together, yet virtually, is extremely important. And the speaker is switching to Basque again. I'm very sorry, but there's no translation from Basque. Now English.
2020 urtea erabat ezberdina da pertsona guztiontzat. Pandemiak arlo guztiak eragin ditu eta guk moldatzen jakin behar izan dugu. Gure eguneroko ohiturak aldatu behar izan ditugu eta gure proiektuak ere erabat ezberdinak dira gaur. Nuestro panorama nada.
Our landscape has nothing to do with the beginning of the year. We didn't know what awaited us, so we've had to set up different measures without an instructions guide. And we didn't know what to do, how to do it, and there was a great deal of uncertainty. Right now, we have new routines, new habits, and each one of us have had to adapt. But this is nothing new. We had to adapt and respond to new needs, and also from institutions. Juan made a reflection, and he also, and I'd like to thank him for his words when thanking us regarding our cooperation in order to tackle and address the needs of the most vulnerable groups who, as a result of the pandemic, saw their problems worsen. New problems and other existing problems had become worse. And knowing what to do is important. Work in coordination with institutions and the third sector, but it's also important to see how to do this. And as I see things, there are two important lessons we've drawn from this pandemic. First of all, coordination is essential in order to be able to tackle problems. Nobody has a magic solution, and therefore we all need to share in order to keep on making progress and counting on the rest and prioritizing different situations, some in the short term that we dealt with urgently. As Juan said, from the government, we increased social economic aid. We created a fund in order to take care of these needs that had cropped up and had become more acute. And we also took into account the groups that were being most affected by the pandemic, among which we see the elderly. And there's a group we were extremely concerned with right from the start. So we tried to come up with solutions, accompanying them with volunteer workers, with volunteers in order to take care of different sides of the crisis. And the president also speaks about an emotional crisis, something that we were not able to see, but which we are suffering. In any case, we know that something is happening, and we are trying to devote resources in order to take care of these very tough situations, this non-desired loneliness situations. So we've worked very closely together, and this is something we should be proud of. As I was saying, we've had to adapt in order to respond to all these needs, and this is something we've had to do from different institutions. Today, you're going to be able to address all this, and I'm convinced that this seminar will result in wonderful ideas for best practices that can be applied elsewhere.
So this is the objective we've set for this seminar, because whatever we do and whatever we share, I'm sure that the solutions will be very enriching. And I know that our colleagues or neighboring regions or neighboring countries, things that they implement, I'm sure that they will be able to help us, because at the end of the day, we all share goals. And being age-friendly is not an exotic issue, because we didn't set out from scratch, because the Basque institutions had already been focused on providing the space that you people require, that you elderly people require. But the network has been here to boost it. But our network has more than 66 municipalities, as Vanessa pointed out, with a very solid track record. And in recent years, there have been many initiatives that have cropped up and which have been implemented in order to try to make our districts and our neighborhoods much more age-friendly. She's now speaking in Basque, I'm afraid, for which there's no translation. So we'll have to wait until she goes back into Spanish again. And it's necessary for us to take this into consideration due to several reasons. But above all, and the most important thing, because it's fair, and because we cannot forget that in 10 years, more than half of the Basque population will be over 55. And in this particular context, each municipality or each town or each city is going to deal with a number of elements that have to be dealt with properly, and we'll see how other best practices have been implemented in other places, and that's going to be very helpful. And this is the goal of this seminar. And we want to compare our reality with the realities of other places, and we want to copy the best practices which we believe can be replicated. We can learn and we can adapt these projects, and that is going to be very helpful for this, but without becoming self-complacent. We also have to be aware of the fact that here at home, we already have projects and initiatives that I do believe deserve to be recognized. And this is why we have the award to best practices and age friendliness, which this year is going to be given to a project in Vitoria. So congratulations. And congratulations to all of the municipalities that are involved in this project with your best practices. And I want to encourage town councils to carry on working in the field of social innovation. And I would like to encourage you to increase these initiatives that are going to engage older people in public policies, because I believe that if we take into account the views of the people that are going to be receiving the project and the views of those that are suffering these problems, I think that whatever project we institutions will implement is going to be much richer and it's going to be much better focused, and it's going to be shared by more people. But we also have to establish objectives, and I know that with these objectives, it's going to be much more efficient. And our association is one of the most powerful networks of the world. As I said, there are 66 municipalities involved, but they are different-sized municipalities with different realities. And this diversity is really positive for our work. Together, we share the vision of building cities and communities that are adapted to older people, and this is one of the political takes that is working very well. And at the Basque government, we are convinced that this is working, and I'm coming to the end of my presentation. On the age-friendly program, it's older people, that's you people, you men and women who are the protagonists of a generation process that is going to have positive repercussions for your daily lives. That means that we're going to have a much more rational recovery of public spaces and a much better relationship between citizens. So, in other words, it's all of these little things that make our daily lives in cities or in towns be much more humane and much more satisfactory for everybody. And this also has a repercussion on older people, but it also affects the rest of our citizens. It's now Basque again. Well, I hope and trust that this will be a productive seminar. Let's hope that we'll learn from many other experiences, because we have lots of things to teach and to share. But as I said before, if what we do is very important, what is equally important is how we do things. And I think that seminars like the one we're about to hold today will help us do things a little bit better. Thank you very much.
Eskerrik asko baita zuri ere, Artolazabal sailburua.
More remarks are being made in Basque now, so we'll have to wait. Yet again, sorry, but they have not provided translation from Basque into anything. As you know, this network of age-friendly communities and municipalities is worldwide. And as has just been pointed out by the councillor, we like to use as an inspiration what other people are doing in other parts of the world. So this is why the opening lecture is going to focus on Great Britain, and it's going to be given by Professor Christopher Philipson, who's one of the pioneers and experts in this particular field of age-friendly concepts. And he's going to be talking about how to recover these age-friendly communities in this context that has been produced by Covid-19. Let's see if he's here. Unfortunately, he's not physically present in Bilbao. He's in the UK. So, Professor Philipson, good morning. How are you, sir?
Morning.
Can you hear us? We are calling from Bilbao.
Yes, I can hear you.
Welcome.
Can you hear me?
Bueno,
Well, in the meantime, and whilst we establish contact with him, I would like to give you some data on his CV. Professor Christopher Phillips is a professor of sociology and social gerontology at the University of Manchester. He's also the co-director of MICRA, which is the Manchester Institute for Collaborative Research on Aging, and he's been a member of the advisory committee of the New Dynamics program, New Dynamics of Aging program. And he's also a member of the advisory board of the Norwegian Life Course in Aging and Generations panel studies. So it's a study in Norway on aging and generations. Well, just to give you a couple of references, that is, a couple of positions he's held. So for those of you that are watching us online, we would like to encourage you to send us your questions, any questions you have, and not only for Professor Philipson, but as from this moment, for all of the people that are going to be participating in the seminar. And in the case of Professor Philipson, we will ask the questions after the first panel that is also going to look into cases of good behaviours in the UK. So let's see if the connection is ready with Mr. Philipson. Hello. Good morning, Mr. Philipson. Hello, sir.
Yes.
Good morning. Yes, we hear you from Bilbao.
Morning.
Welcome.
Morning.
I
It's a
just
pleasure to be
introduced
here.
you, so I give you the floor. Si
I give you the
quiere, ya le damos la palabra.
And you have the floor because we've just introduced you and we want to listen to what you have to say as regards this recovery plan that you want to present for age-friendly communities in this context of COVID-19. So go ahead, sir, please.
Well, it's a great pleasure to present your which I think is really extraordinary. One of the urgent issues, the age-friendly move at the present time. If we could go on to the first slide. If I could, in areas which I cover, to explore the background to the debate on age-friendly communities, some of the policy issues influencing the urban agenda on age-friendly issues, some of the achievements of the age-friendly movement, and look at some of the challenges in relation to the issues posed by Covid-19, which are clearly raising a lot of important questions for us. And then I also want to develop what I think might be some kind of recovery planning strategy. So in terms of the growth of the movement, I think we've had an extraordinary surge of interest in developing age-friendly cities and communities. From the launch of the global network of age-friendly cities in 2010, we now have around 1,000 members, of course, and this is an extraordinary achievement. And I'd certainly want to pay tribute to the work in the Basque Country, where we have an extraordinary level of activity. And I think this is so important at the present time, given the pressures upon us. So what are the debates that have been influencing the movement? I think that age-friendly movement has emerged out of a whole range of discussions, and it's important to recognize these. First, we've had a discussion about building sustainable cities, sustainable communities that can meet the needs of current and future generations. Secondly, we've had an important intervention by the United Nations on how we achieve social justice in the city, or the idea of harmonious cities, harmonious communities. And thirdly, problems in relation to developing more unequal, the development of unequal cities, which has become a big issue, I think, for Spain, for the Basque Country, and for the UK, in terms of how we reduce the health and income gap between neighbourhoods. And of course, we've also had the development of this policy of ageing in place, the idea that older people would prefer to live in the communities which they've spent the majority of their lives, and the idea of trying to develop lifetime homes and neighborhoods. What are some of the achievements of the age-friendly movement? I would probably single out four which have been important. I think, firstly, greater recognition in planning, regional planning and town planning, of the implications of population aging. Secondly, the development, particularly important, of course, in the Basque region, of organizations and networks at regional and local government levels. And you have now, I think, 65 municipalities involved in developing age-friendly issues. So this is an extraordinary achievement. Thirdly, interventions supporting the empowerment of older people at a neighborhood level. I think a really significant discussion here about how we give different groups of older people greater control within their localities. And finally, the importance and issues which I know have been important in the Basque region, campaigns around ageism and intergenerational solidarity. But on the other hand, I think it's clear that COVID-19 is raising a significant challenge for the age-friendly movement. And for a number of reasons. We have evidence for increasing inequality between poorer and wealthier neighborhoods. And in the case of England, I should just note that people in poorest communities have been dying at twice the rate of COVID-19 as those in richer areas. And of course, all of this has followed on the austerity policies following 2008 financial crisis, which cut many of the key services necessary for tackling the pandemic: health personnel, public health, nursing home care. So we've had austerity for a number of years, and COVID coming on top of that. And this has been a problem for both of our societies, both of our regions. Greater Manchester hit very hard by austerity policies. So I think this is, one of the big challenges that that we face. Thirdly, we've had, unfortunately, the rise of ageism in the context of COVID-19. And I know this has been the subject of studies in your own area. And we've certainly seen it in the UK. And I'll come back to this point. And finally, a disturbing rise of violence against women by male partners. Of course, this is true across all age groups. But I think it has been an area of great concern in the UK of women trapped in their homes and subjected to abuse at higher levels because of the restrictions posed by COVID-19. So I think in this context, we have to look at how we develop a strategy for recovering over the medium term, at least, from the challenges posed by COVID-19. And I've highlighted four areas here: developing community support, combating ageism and discrimination. Thirdly, developing an age-friendly strategy for nursing and residential homes. And finally, planning for the future, some suggestions there. So on the first of these, I think we're looking, certainly in the UK, we're looking at the importance of extra funding for the poorest communities to combat the effects of COVID-19. There's no question, and I'm sure this is true in the Basque region as well, that it is the poorest areas that have suffered the most in terms of mortality, in terms of general crisis of health and finances from the effects of COVID-19. We've had, I think in response to this, I think we do need to look at the models of neighbourhood working at a local level. Can we strengthen organisations at a local level? I think, you know, cooperatives, people coming together, supporting each other over different issues is one way of thinking about this. And again, I know that's an area that is of interest in the Basque region. Thirdly, we do talk a lot, certainly in the UK, of the idea of co-research by older people themselves, older people working alongside researchers, academics, to identify issues and concerns within their community. I think then we also need to think about community leadership. The impacts of COVID-19 and social distancing has been to fragment communities, I think, in different ways, certainly to fragment generations and cause potential divisions within generations. So looking at the idea of community leadership, I think, is particularly important. And finally, in urban areas, again, one of the debates we're having is how you strengthen ties between big institutions, what we call anchor institutions, universities are an example, and low-income neighbourhoods. So perhaps using the resources of universities, not only their research, but the income that they have, to work with and support in different ways the neighbourhoods which they are surrounding them. Second area I think we have to include in our recovery is the issue of ageism and discrimination. And here I think we have had evidence for the rise of ageism with COVID-19 and older people presented as a increasingly as a burden and cost to society. It is also the case, I think, that the pandemic has increased difficulties of those in minority and LGBTQ communities. We've seen some evidence in the UK of greater pressure on those communities in the context of COVID-19. So I think I would make 3 points here. Firstly, that the age-friendly movement needs to link with equalities organisations to ensure that the work that we're doing to recover from COVID-19 is responding to intersecting issues of ageism, racism, and sexism. Secondly, I think elder abuse does need to have a more prominent focus in age-friendly work. Again, I know this has been a big issue and big area of research, but the concern is that its prevalence may be increasing given pressures on families and communities. we really don't know enough about this, and I think I would urge some attention to this question at the present time, and certainly extending work strengthening intergenerational ties. Again, I know this has been a feature of work amongst many of your municipalities, and it seems to me at the present moment that it's become even more important. Thirdly, a third arm of my recovery plan is in relation to nursing and residential care, where, of course, 30 to 40% of deaths have occurred in residential and nursing homes in many European countries. This has certainly been a big issue in the UK, and I think we have to face up to the real challenges which older people have in this institutional context. So we need, I think, first to incorporate care homes into age-friendly planning and activities. Historically, I don't think we've really done this. Age-friendly work has tended to operate outside residential nursing home sector. I think we need to be thinking about how we develop new models of residential care. It's clear that, particularly for those diagnosed with dementia, it's clear that existing types of residential and nursing homes have been a real issue in terms of COVID-19. The evidence in particular is that the large homes have had a higher mortality rate than smaller homes. So we need to look at that. But I think look generally at the type of support we provide for those who are especially frail, who have cognitive difficulties of various kinds. We, of course, need to transform the pay and conditions of those working in care homes. The COVID crisis has thrown a spotlight on what is really the exploitation of women working in homes, often poorly trained and doing as best job as they can, but really challenged in the context of COVID-19. And we need to protect the rights of residents of care homes. And we've had a report from Amnesty International in the UK on this issue, that the rights of people in care homes have actually been neglected severely. And this is shown up by the COVID crisis. I think finally, planning for the future. And I've identified 5 areas here. I think we do need an age-friendly strategy which responds to the likely medium-term continuation of social distancing. The reality is that really over the next 2-3 years, we may have to continue the kind of relationships that have emerged to protect ourselves from the spread of the virus. There's no quick fix on offer. And thinking about the implications of that for age-friendly work seems to me extremely important. Secondly, the age-friendly movement will need to collaborate with other organisations working in areas such as healthy cities, smart cities, and around climate change, which is affecting us all, of course. We need a stronger age-friendly movement, and I think that will only come with linking up with these other organisations. There's a worry that new inequalities may emerge as COVID-19 continues. Digital exclusion is one obvious one. Some groups of older people who may be less familiar with technology will experience inequality as a result. But more optimistically, it may be that new solidarities may also emerge with the rise of mutual aid, cooperatives, improved relationships within neighborhoods. So we may have a society where there is more cooperation, more solidarity as a result of having to fight the virus. And finally, I think developing research collaborations is very important. And I think trying to link up research institutes, I would certainly encourage that, and joint projects, comparative projects, comparing the experiences between, say, Greater Manchester and municipalities in the Basque region would be, I think, very exciting. Finally, just some questions for the age-friendly movement and to start a debate. And I've just identified 4 here. First, can the age-friendly movement be part of the drive to address issues of inequalities in social justice and rights affecting urban life? We do have seen the upsurge of inequality in various forms in different communities, and I think the age-friendly movement needs to think about how it addresses those. Post-COVID, can older people play a bigger role in the future planning of cities and regions and the communities within them? That, I think, should be a big concern for us. Thirdly, can the age-friendly movement play a leadership role in challenging the impact of ageism, helping to bring different generations together? And finally, can the age-friendly movement contribute to the debate about what kind of post-COVID society we want to rebuild or recover? I think society cannot go back to what it had been previously. We do need to think about a more equal, solidaristic society, and the age-friendly movement, I think, could make a great contribution to that. Well, it's been a great honor for me to present at this conference, and I look forward to any responses or issues to the questions raised.
Y luego abriremos una mesa de diálogo con los 3, con vuestras preguntas. Bien, vamos a arrancar ahora con la mesa de buenas prácticas en Europa, con los 2 ponentes que también nos vienen desde Gran Bretaña. Os presento, antes de nada, a los miembros de esta mesa, que esperamos sea inspiradora. El profesor Thomas Scharf es profesor de Gerontología Social en la Universidad de Newcastle. Actualmente codirige un nuevo centro de investigación en esta universidad que se centra en desigualdades en las personas mayores, y anteriormente fue director del Centro Irlandés de Gerontología Social, denominado NUI, de Galway. Desde 2019 es presidente de la Sociedad Británica de Gerontología, forma parte de la Junta Asesora de la encuesta alemana sobre el envejecimiento y también ha participado en el estudio longitudinal irlandés sobre el envejecimiento, llamado TILDA. Y el otro ponente de esta mesa es Paul McGarry, que desde 2003 dirige asociaciones multiinstitucionales para el envejecimiento urbano. Desde 2016 es jefe del Greater Manchester Aging Hub. Para entendernos, en Euskadi es el Lagunkoya de Manchester. Y Paul McGarry también es miembro, investigador honorario de la Universidad de Manchester y ha sido miembro del grupo asesor de la Red Mundial de Ciudades Amigables con las Personas Mayores de la Organización Mundial de la Salud. Bien, creo que ya están allí. Good morning, Paul and Tom.
Buenos días, Paul
Hello.
y Tom. ¿Nos oyen?
I can hear you very well.
Sí, le oímos muy bien. Creo que le podemos ver a los dos, a Tom y a Paul. Me gustaría pasarle la palabra en primer lugar a Thomas.
For about 20 minutes, and then it will be Paul's turn. So, Thomas, I give you the floor. We are listening to you.
Thank you very much, and thank you for the introduction. Yesterday was the International Day of the Basque Language, and I have a very close personal bond to the Basque country, but really struggle with the language. So I'd like you to forgive me if I just want to say a couple of sentences, first in Basque.
We are listening to you.
Ara, tik. And then to avoid a diplomatic incident, I'd like to add in Spanish, siente mucho no poder atender a la conferencia en persona. Next slide, please. My topic today is COVID-19 and social exclusion in later life, lessons for age-friendly communities. Next slide. I'd like to cover 3 topics over the course of the next 15 to 20 minutes. The first looks at how we understand the idea of social exclusion, especially in later life. We then will look at issues relating to social exclusion and COVID-19, focusing on evidence of exclusion that affects older people during the course of the pandemic. And my final thoughts really reflect on lessons for age-friendly communities. So how should communities respond to risks of exclusion in later life? And this really leads into the discussion and partly builds on what Chris Phillipson has already been arguing about the role of inequalities in relation to a COVID-19 response. Next slide. So how do we understand social exclusion? Well, the research over the last 20 years or so has identified exclusion as being a multidimensional idea, as an idea that has a dynamic characteristic, that we can only think about exclusion in relation to other groups and other individuals in society, and that exclusion also implies a degree of agency, that people are excluded by the behaviors of themselves or by the behaviors of other people and other groups. And this is reflected in Hilary Silver's definition of social exclusion, where she says that exclusion is a multidimensional process of progressive social rupture, detaching groups and individuals from social relations and institutions, and preventing them from full participation in the normatively prescribed activities of the society in which they live. And I think this idea really hits a nerve during the course of COVID, when many people, not just older people, have been detached from participating in what would be regarded as a normal set of experiences over the course of for their daily lives. Next slide. And while Chris Phillipson and I have done work on social exclusion or been involved in research on exclusion going back for 20 years or so. It's really in the last few years that we have branched out and been able to look at experiences of social exclusion, characteristics of exclusion across a much wider range of settings and societies. And this has been a feature of the RoseNet Cost Action. It's a collaboration supported by the European Union's COST programme, a network involving over 180 researchers and policy stakeholders from 41 different countries, not just countries in Europe, but also spread around the world. And as part of that group, we also involved some older adults from European countries who could help to keep us on track to make sure that what we were discussing was not removed from the lived experience of aging adults. What our focus there was on addressing the gaps that exist in our conceptualizations and understandings of issues relating to social exclusion in later life. And what we really wanted to do was to draw together the science and to link it with policymakers and with citizens to really help to understand how best to tackle some of the challenges associated with social exclusion. And later this month, we have a book that's being published that will be free to download for anybody that reflects on the experiences of that substantial network of researchers and policy stakeholders. Next slide. So what are some of the key characteristics of exclusion in later life as opposed to exclusion at other stages of the life course? Well, these are some of the lessons that we know from the work that's been done over the last 10 to 15 years. We know that exclusion is multidimensional, that it involves things like poverty and loneliness or exclusion from civic activities, that we know these different forms of exclusion can become much more prevalent as people age, that in some societies the risk of poverty really increases exponentially with old age. But we also know that some people reach later life already experiencing forms of chronic exclusion that have been addressed over the course of, that have emerged over the course of an extended life, and that the different forms of exclusion that people experience may intersect to create multiple really challenging situations for people who, for example, experience exclusion from their community, are living on a very low income, are digitally disconnected and unable to access commercial and public services. So what we'd argue, I think, is that exclusion in later life is qualitatively different from exclusion at earlier stages of the life course. A key feature here is that one of the arguments made, for example, about poverty and reducing poverty, which is a key feature of social exclusion, that younger people have more opportunities to escape poverty through participation in the labour market, for example, than would be the case for older people who lack access to labour market participation, who can't lift themselves out of poverty. And the same arguments could be made for such forms of disadvantage as loneliness, isolation, digital exclusion, where the state or society may need to intervene to support people to become less excluded. So what we know is that where different types of exclusion are involved, that it's also helpful to adopt an intersectional approach that highlights the way in particular groups, particular social groups, are disproportionately affected by multiple forms of exclusion. So this really relates to people, for example, in advanced old age, women in advanced old age, who may have chronic health problems, that they are much more disadvantaged than other groups who are reaching older age in a more secure position. Next slide. And this is the way in which we, as part of RoseNet, have developed a framework for thinking about exclusion in later life, and also the ways in which different forms of exclusion can intersect to create really difficult challenges, not only for the individuals involved, but also for policymakers who are seeking to reduce forms of exclusion. So we have defined exclusion in later life as being a complex process that involves the lack or denial of resources, rights, goods and services as people age, and the inability to participate in the normal relationships and activities available to most people across the various domains of society. For me, what's important about the idea of social exclusion is that people who are socially excluded experience a much poorer quality of life, a much lower level of well-being than people who are not excluded. So if we regard addressing exclusion, we also then focus on the need to improve well-being in later life in aging societies. And what I want to do really is to take you through some examples next of how exclusion in its different dimensions has been a feature of the COVID-19 pandemic. Next. So what is the evidence? Next, please. Next slide. So we start with one of the central domains of social exclusion, which is exclusion from services, amenities, and mobility. And here there are countless examples of ways in which older people have been disadvantaged through the course of the pandemic and become unable to participate in what would be regarded as a normal way of life. Chris has already referred to the impact of digital forms of exclusion. These disproportionately affect older people who don't have access as much as younger age groups to the internet, but who may also be more reliant on particular services that have shifted from in-person services to digital services. For example, access to banking, access to health and social care. So even where health and social care services aren't provided digitally, in the United Kingdom at least, and I'm sure this is the same in many other European countries, older people have found it much harder to access health services, social care services. We've seen a loss of home helps in places. We've seen difficulties in reaching a general practitioner service, in accessing hospital care services. In addition to that, all of us have been affected by restrictions placed on the use of commercial services, but also there are risks associated with public transport use, where older people are more likely to be dependent on using public transport, but use of public transport is then associated with increased risks of infection, and that many older people have felt that that was not worthwhile taking the chance to move around using public transport. Next slide. We also see forms of exclusion over the course of the pandemic in relation to people's material resources. A key issue currently, but also for the future, is the impact of COVID-19 on the labour market. We see a lot of talk about younger people being affected, but there is also increasing evidence that many older people, 50 and over, are becoming detached from the labour market, And what we know is that these groups will have difficulty in the years ahead to regain access to the labour market. So we'll be thinking about the need to introduce active labour market policies to re-engage older people so that they can support themselves financially in future years. There are some older people are affected by a growing risk of poverty in terms of an inability to access their resources or the supports that they are providing to younger family members over the course of the pandemic that place their needs as being secondary to the needs of younger family generations. And there are widespread reports in the UK, in the United States, and also in other countries of older people who are cutting back on essential items of expenditure in order to make ends meet. And we see worrying reports about malnutrition, about older people being forced into the use of food banks that really point to the precarity of many older people's material resources. Next slide. There's been a lot of attention on what we would refer to as exclusion from social relations. And this affects the impact of COVID-19 and the restrictions arising from that, the impact on the quantity and quality of people's social interactions. So we know that loneliness has been a key challenge for large numbers of older people, especially for older people and their families, older people living in care homes. But at the same time, I think it's important to recognize that we wouldn't want to use this as a way of further stigmatizing older people. The evidence in the United Kingdom is that younger age groups have become more at risk of loneliness than older age groups. But loneliness is a devastating condition at whatever age that arises. So we need to develop community responses that can help to reduce risks of loneliness in later life. Next slide. A key feature of exclusion is the sociocultural dimension. And this speaks to the widespread ageism and age discrimination that have become central features of the pandemic. In my work, I've been looking at negative images and negative language used to represent older people in public discourse. I'm sure this isn't just a characteristic of the UK. Next. We can think about exclusion also from neighbourhood and community, reflecting on the feelings that people have about the domestic environment and about the neighbourhood environment in which the people age, and thinking about the inequalities that exist in how people living in different types of housing, different types of community have been able to manage their daily lives. There's a big difference between people who are living in relatively green areas with access to good public space, as opposed to people who are living in high-rise apartment blocks with very little access to good public space. Next. And then in the final area of exclusion, we think about exclusion from civic participation, which focuses on the ways in which people are prevented from contributing to civic activities and the ways in which older people's voices have been neglected in policy making and decisions that really affect older people and their lives, and in a basic lack of regard for people's human rights. Especially this has become evident in care home settings. Next. So my final thoughts really are, what does this all mean for age-friendly communities? And what I would argue, and I think what I've argued even before the emergence of the age-friendly movement, is that local authorities, that communities and regions need to really develop strategic thinking around how to reduce forms of social exclusion. And the age-friendly movement allows us to take these ideas forward into concrete actions that focus on reducing the risks of exclusion across its various dimensions with a view to improving older people's quality of life. Even without the age-friendly movement, these should be important local strategic priorities. So this really involves reducing poverty and material deprivation, developing responses to loneliness, improving access to services and amenities, ensuring that older people are able to participate in decisions that affect their lives, tackling ageism and age-based discrimination, and promoting connections to home and community. And this really, for me, aligns very well with the age-friendly movement, but shifts the focus somewhat to really improving the lives of people who experience the most acute forms of disadvantage in later life. Thank you for listening.
Well, thank you very much for you too, Thomas Schaar, for sharing with us your lessons for age-friendly communities. We took very good notes of your inspiring presentations. And we are starting to get some questions for you, but may I ask you to hold on for about 20 minutes, and then we will ask all those questions to you and to the either to Professor Philipson and to Paul McGarry. We are going to join him now. Paul, are you still there? Welcome to the conference. Yes, hello. Now we can see you. Well, we are really looking forward to hearing your presentation about how you are responding to this crisis in the age-friendly community of Great Manchester. I give you the floor. We are listening to you. Welcome. No, we can't hear you. Hold on. Just 1 second. We're going to make some tests.
Can you hear me now?
And hopefully, yes.
Okay.
Now go ahead. Yes, we can hear you now, I think.
Thank you so much. It's a huge honour to take part in this event and to take part in this event with my colleagues Chris Philipson and Tom Scharf. And I should mention at the outset that I was a student of Tom and Chris, and probably, I think it's fair to say, still am their student. So I'd love to be joining you in Bilbao and to enjoy the Basque region, but we are where we are in a slightly overcast Manchester. So if we move on to the first slide, please. And the next one. So I wanted to cover three topics really in my allotted time. The first one is to describe what the Greater Manchester Ageing Hub is, what its ambitions are, how we involve different stakeholders and not least groups of older residents in our work. Secondly, I want to set out the measures that we've been taking as a city region and as a group of agencies during the last 9 months or so. And then I just want to set out some of the things that we're planning into next year and beyond. And hopefully what you will see through this presentation is commonality in terms of conceptual approach, but also practical implementation with the two presentations that you've already heard from the UK this morning. Next slide, thank you. So the Greater Manchester Ageing Hub was established in 2016 to coordinate a strategic response to the opportunities and challenges of ageing populations. Greater Manchester is a regional authority of 2.8 million people, 10 municipalities, and our mayor, elected mayor, Andy Burnham. Mayor Burnham was the health secretary in the last Labour government and is a high-profile politician here in the UK. Ageing is one of the 10 priorities in the Greater Manchester Strategy, and we joined the WHO's age-friendly communities programme in 2018 as a city region. I mean, I should add that Manchester, where I worked for before Greater Manchester, joined the WH programme in 2010. And this is work that I've been involved in on and off, I guess, mainly on since about the mid-1990s. And we also have a strategic partnership with the Centre for Ageing Better. So the Centre for Ageing Better is a What Works centre here in the UK, focused on ageing, and we've had a very strong partnership with them. Next slide, thank you. So, I mean, the case for change in Greater Manchester is very similar to the rest of the UK and indeed Western Europe and North America and other parts of the world. But it's always, it seems to me, critical to continue to make the kind of outline of this fundamental change in the demographic profile of our populations. And we continue to make the point that when we're sat in local government and other agencies in 20 years' time, the places in which we live and work, the economy, the social relationships are going to be fundamentally different than they are now. And that we need to plan for that change immediately. And COVID has demonstrated the need to do that. Next slide, thank you. So this is a map of Greater Manchester, and I guess our point here is, and again, echoing points that have already been made, is that people are ageing unequally in Greater Manchester. So where you can see the darkest blues, I think it is, are in the inner city areas, really. And these are where you've got the highest levels of people on out-of-work benefits in their 50s and beyond. And that obviously is a significant challenge for us. If you're out of work in your 50s and on low incomes, the likelihood is that you're going to continue that pattern into later life. We also know that around about 50,000 people of pensionable age in Greater Manchester currently live in poverty. And we know that there are significant concentrations of income deprivation in different areas of Greater Manchester. Most worryingly, in some respects, is the analysis from colleagues at the University of Manchester and elsewhere that the inequalities for the poorest 20% of our older population in relationship to the rest of the older population are actually growing in terms of health and poverty and so on. So we have the prospect of and the demand really to focus on this poorest 20% in our programs. Next slide, thank you. So I put this in really because this is one way that we try and explain to our colleagues in public health agencies, in local government and the NHS, the relationship between the work that we lead and current other, if you like, stories or narratives of ageing. And it draws really on the conceptual approach that Tom set out and on the literature associated with the kind of critical social gerontology movement. So what we try and describe here is that our work is not just about the kind of biomedical or social care gaze, which sees older people as patients or customers, which tends to focus on the scale of the individual or the family, and talks about commissioning for very small numbers of older people. What we want to do is focus on and think about older people as citizens with agency. We want to focus on the scales of neighbourhood and city. We want to promote social capital and participation, reduce social exclusion, and change social structures and attitudes towards ageing. So this is a huge ambition in many ways. But unless I think you get this story right, and unless you argue these key points in the arenas in which we work, then you're unable really to assemble the coalition of partners you need to do. So next slide, thank you. So in 2017 and 18, we published our age-friendly strategy for Greater Manchester. And these lines that you see before you represent the 10 boroughs with the different age profiles. So the third one down you can see has this kind of younger people's bulge that between about 80 and 25. And you'll see some of the other authorities have a lot older population. So there is significant differences across Greater Manchester. The other thing about this slide is that it's homage to the well-known Manchester rock group Joy Division and their album Unknown Pleasures, and is a rather crude device to engage the middle-aged men and women in Manchester who make decisions about budgets. But that's maybe a discussion for another time. Next slide, thank you. So we have been working on a recovery strategy, and I'm going to go into detail in some of the other slides about some of these elements. But these are the themes that we've developed with our partners. I'll pick up the narrative issue elsewhere and the employment and financial security. I'll mention homes. So we have a significant program of work trying to integrate issues of population change and demography into Greater Manchester's plans over the next 30 years for its housing stock and its urban design. And these are always significant challenges for us because particularly in the UK, these developments are driven by developers and by kind of market interests, and less so by the abilities of citizens and local agencies to shape those things. I'd also highlight this issue of digital inclusion or exclusion. In Greater Manchester, something like 200,000 people do not regularly use the internet, of which 80% of those are 65 and over. So when I come on to other slides, I will describe the measures that we're taking around that. And last but not least is the focus on inequalities around not just, I guess, poverty and social class, but of ethnicity, gender, sexuality, and disability. So this is the kind of framework that we are using in the next stage of our work. Thank you. I just wanted to mention a couple of ongoing pieces of work which we think are critical. So the first one relates to issues of older workers. We know from data from earlier in the pandemic that the impact on workers is a kind of U-shaped impact, with the biggest impact on younger workers, but also an impact on older workers. And what we do know is that if people lose their jobs, particularly those on traditional skills, or not, or people who don't have digital skills, that the chances of getting work if you lose your job in your 50s before state pension age in here in the UK are very low. So we're taking specific measures, working with our GM agencies and with national agencies to try and work out how we can support over 50s back into work with specific programs around across a range of different issues. We've also launched a new agency which is called CADA, which is a creative ageing development agency, and we're looking at the next phase of our work around Culture Champions, which is a program for engaging particularly people on low incomes through cultural organisations. And we've just submitted this week a bid for £12 million to establish a agency for age-friendly design and a new platform for socialising tech-enabled care. Thank you. So this is some of the work that we've been doing over the last few months. I should say, in addition to this, the whole of the GM system has been mobilised to provide community response in terms of food and medicines and so on. And our housing organisations have been providing regular phone calls to people who are at risk of isolation. But these are some of the specific things that we've done as an ageing hub. The first thing is that we produced a booklet which you can see called Keeping Well at Home, and we distributed those to 70,000 people in Greater Manchester, and has been syndicated by 9 other local authorities in the UK and also in Australia and Canada. We've also published a creative care kit, which you can see there, which went out to 15,000 residents, which was a guide to staying creative or being creative during this time. We've run a campaign called Valuable Not Vulnerable, which is a series of resources and films trying to disrupt this ageist narrative that we have. And we've also worked with colleagues in Micra and elsewhere to gather research analysis and insight into how older people's are doing during COVID. And we've produced new guidance and practice with our colleagues in the voluntary sector in our Ambition for Ageing programme. And we've also worked with our UK network of age-friendly communities, which has 44 members, and with our European and international network. So we've just published with Zaragoza, excuse my Spanish, and Barcelona, and a range of other European cities, a new set of reports called Adapting Cities for Population Ageing, and I'll mention more about that at the end. Thank you. Next slide. So I just want to move on to our present campaigns. So this one is Keeping Well This Winter. We have some key messages because we're worried about this process of deconditioning, physical, cognitive, and I guess emotional deconditioning, which is a huge challenge for people who are staying indoors at the moment. So our key messages around keeping active and connected, staying safe and well, but also advising people on money and their home improvements. You can see one of our older people's activists being interviewed for a film that we made just out of his house, side of his house here. And the campaign resources include 150,000 printed copies going out across Greater Manchester as we speak. We have a film co-produced and fronted by older people talking about the things that are important to them. That's on YouTube. And we've also provided a talking tips guide for conversations about keeping well that frontline staff and older people themselves and families can have with their older family members and friends. And that's being distributed with our colleagues through the fire service, police, housing organisations, social care agencies, and so on. And we are currently mobilising these resources across the city region. Thank you. We are also running a campaign focused on increasing the income of the low-income older people. We have an entitlement here in the UK called pension credit, and around about £100 million goes unclaimed each year in Greater Manchester, and it's worth on average £3,000 per family. So we are targeting people eligible for this benefit over the next few months. Thank you. And I just wanted to say how we're working internationally. We, as I mentioned, just finished work on the ACBA project. We work in the Eurocities Urban Ageing Working Group, and I would encourage Basque cities and larger towns to look at being involved in that programme. We also work in the European Innovation Partnership as a 4-star reference site, and through Micra in the academic partnerships. We've also published a local industrial strategy here in Manchester, which has commitments to establish a new innovation partnership on action for healthy ageing around developing new goods and services for this idea of a longevity dividend. And we are planning to establish a new international centre to enable us to do that. Thank you. So just some next steps for work that we're doing. We are building our movement, our age-friendly movement, through our 10 municipalities. We are increasing the capacity of sharing good practices across our 10 authorities, and absolutely critically, we are building older people's participation and voice. We are also building our 53 mayoral challenge areas, which are areas where local communities have come forward to make their local communities more age-friendly. And we are building for a new Ageing Well programme. And last but not least, continue with our international work. Thank you. So our slogan is doing ageing differently. We want and we are committed to creating better lives for older people by working with older people and by working with a wide range of agencies. It's a great honour to be able to finish my contribution this morning, and I look forward to the next time we meet, which I'm sure will be in the beautiful city of Bilbao or San Sebastian or close by. Thank you very much. We want
points the age-friendly communities have to tackle these days, particularly during the pandemic. Someone was speaking, excuse me. Okay, well, sometimes it's not easy to communicate, but anyway, we really want to thank you, and actually the audience is also thanking not only the people who are speaking during the conference, but also the organizers. So thank you very much to everybody who contributed to create this conference. Es el turno de preguntas ahora. Now we are going to ask you some questions. Pregunto, en primer lugar, I'm going to ask the audience here in Bilbao if they have any questions for Paul, Chris, and Thomas. ¿Hay alguna pregunta para...? Sí, aquí mismo. I'm going to listen to it in Spanish, and I will translate it, so...
Excellent. Very good.
Please be patient. Thank you.
Buenos días.
I assume Tom can understand already.
Adelante.
Sí, seguro que Tom me entiende. Hi, Tom, how are you? Buenos días, un placer escucharos a todos en esta nueva situación, en esta nueva realidad. Gracias por vuestras intervenciones. Yo tengo una pregunta para quien quiera responderla, ¿vale? ¿Qué podemos hacer las personas a lo largo de la vida para prevenir la exclusión? En especial hago referencia a esto que es tan importante, que es el edadismo, ¿no? ¿Qué acciones se pueden hacer o qué pensáis que se puede hacer, sobre todo desde una perspectiva de ciclo vital, ¿no? Teniendo en cuenta que esto de los edadismos se basa mucho en las creencias que hay en relación con el envejecimiento y que esto se aprende a lo largo de la vida.
Okay, vale, muchísimas gracias. Thank you very much. This lady is asking the three of you, what can we do to prevent exclusion during our whole life, but regarding ageism, of course? What can we do through our whole life?
Yeah, I think, shall I come in first? I think this is where, I think the issue of ageism really has emerged as a major issue through the pandemic. And I think bringing generations together is a really important part of the strategy here. But I think that has to be done at a local and neighbourhood level. And I think we need to think about meaningful projects where different age groups can work together. That's one important part. The other important part is something which I know Paul has developed, pioneered really in the case of Manchester, and that is campaigns which present positive stereotypes about older people, and they, I think, can be extremely effective. Of course, universities can play a role. Students working with older people on different projects, we've had that in Manchester as well, and I suspect you've had that. So I think there are different strategies here, but I think having a life course approach, as your questioner was suggesting, is extremely important.
Paul or Thomas, do you think that bringing generations together is the key factor? Well, actually, I know, Thomas, you are very active on social media, fighting against the comments that increase ageism, discrimination, or exclusion with ageism. So how can we bring generations together? Because we see nowadays that sometimes that's not the case.
I would say that intergenerational solidarity is an absolutely essential objective of societies, and with the dismantling of our social protection systems and welfare systems, we've created an environment in which conflict between generations, or the potential for conflict, becomes much stronger. So addressing ageism, I would also see as one way of taking some of the tension out of relationships between generations, and but we need to do that in a really strategic way. So yes, intergenerational programs are really important, but there is a risk from those types of programs that they may actually reinforce divisions between the generations. So we've had television programs that focus, for example, on connecting people living in care homes to children of primary school age. These can be really effective ways of bridging intergenerational divides. But at the same time, there's a risk that they reinforce the sense of difference between young and difference between and old. So it's complex. I mean, my own particular concern has been with the way in which older people are represented in the media, and some of the ageist and stereotypical images that also exist in the Spanish media as much as in the Irish or the UK media. And these are incredibly powerful negative images of later life that really serve to other and to exclude older people.
Thank you very much. And Paul, how do you work in Manchester, in Great Manchester, to prevent exclusion because of aging?
Well, I think to kind of try and relate to the question, we need to be kind of literate throughout our lives about aging. And we need to be able to think about its impact. And I don't know if we're particularly bad at this in the UK. Maybe there's some evidence that we are. But there are, I think, as Tom suggested, there are kind of risks to the intergenerational programs. I've run a few in Manchester over the last 15, 20 years, and they can feel a little bit contrived. But then again, they can also feel, positive. I think right now, I think something practical that generations can do together is maybe think about the environmental agenda, because this tends to be, or it seems to be, an agenda which is a young person's agenda. But you think about those activists from the radical movements in the 70s and 80s, they're in their 60s and 70s now, and it seems to me that bringing together people around campaigns, around joint aims, rather than saying we need to get generations to work together, and planning it in that inclusive way is more effective. Having said that, I think it is important that we do more in our schools and colleges around bringing older people into those spaces, but doing it in a kind of sensitive way.
Okay, thank you very much. We have another question from the audience here. Let's listen to it. Adelante, por favor.
Sí, bueno, muchas gracias a los ponentes por las explicaciones tan interesantes que nos habéis transmitido. Yo me quería dirigir al señor Philipson, me parece que se dice, ¿no? Philipson, ¿está bien
Philipson.
dicho?
A question for Mr. Philipson.
Sí, es en relación al tema de las residencias y de las alternativas posibles a las mismas. Este COVID ha demostrado que, palpablemente, que las residencias requieren pues, actualizarse, por decirlo de alguna manera. Pero también es interesante el que las personas mayores tengamos otras alternativas. Me refiero al deseo que existe entre nosotros, entre las personas mayores, de permanecer en el domicilio el máximo tiempo posible. Eso hace que las administraciones tengan que asumirla o no asumirla, o otras alternativas, como usted ha mencionado, que es la de las cooperativas. Yo soy muy partidario, y conmigo más del 90% de las personas mayores, que su objetivo es la permanencia en el domicilio el máximo tiempo posible. Eso requiere unas grandes modificaciones. Tiene que haber una relación directísima entre los servicios sociales y los servicios de sanidad, entre otras cosas, y que estén en una situación, la administración, que lo pueda asumir. Entonces, mi pregunta es, ¿cómo las alternativas que están ustedes manejando en Manchester tienen relación con el deseo, como aquí, de la permanencia en el domicilio, o están eligiendo otras alternativas, como ha mencionado, de las cooperativas? La Administración, ¿qué es lo que está apoyando y cómo lo ve el futuro de estas situaciones? Más o menos.
Okay.
Muchas gracias.
Muy bien, bueno, voy a traducir ahora. This question is actually for Mr. Philipson, but he mentioned also Manchester, so maybe Paul also could answer. Regarding nursing houses, care houses for elder people, well, there's actually, many people think more and more that we have to change, and you also mentioned that there should be changes in this, in the care system regarding nursing houses, because maybe we could go towards staying at home as long as it's possible. But we need to make changes, and how are the administrations in the United Kingdom tackling this issue? And what are we specifically doing in Manchester?
Well, I really make a general comment. I'm afraid we're not tackling it. I mean, the fact is that residential nursing home sector has been very badly neglected, and that has been shown up, I think, clearly by COVID-19. The sector has been affected by very poor levels of financing, which has meant that cuts have had to be made to staffing. Staff are poorly paid. The environment of homes is a huge problem in terms of providing care and support. And there are a lot of specific problems. So I think, the general point has to be made that I think across many European societies, we are having to rethink just what we're doing with residential care. I think it's unfortunate that the age-friendly movement has not really addressed residential or nursing home care. And I think we are starting to have this discussion in Manchester about how we can bring homes into the debate. I mean, my own view is that the existing model is broken, absolutely broken. Homes are often too large, they're poorly run. But on the other hand, if we're going to encourage, as we are doing, people to stay at home for as long as possible, we need much higher levels of community support. And it's often the home support that's been cut back, as Tom was pointing out, over the past few years during a period of sustained austerity. So I think COVID-19 is actually a wake-up call for us to rethink both community care and residential care in a very radical way. And I think the age-friendly movement has got to play a leading role in that.
Paul, or even Tom, I mean, do you have any other ideas to answer this question?
I mean, I'd say a couple of things. I mean, Chris is completely right. There's been a complete neglect of investment and political and policy attention in general around social care, which I think reflects some of the kind of ageism, really, the structural ageism that we have here in the UK and which has been played out in front of us over the last few months. I think also it's important to recognise that those older people who live in these settings who are on low incomes get a worse deal than those on higher incomes. And I think it's a huge challenge for the next phase of our work. So I'd concur with Chris's observations and comments. And not least the point that he made, which is we have an opportunity now to try and reshape this whole sector and the future of social care in the UK. It's deeply depressing, though.
Some people, the person who asked the question, talked about living in a cooperative. Is it a real alternative for elder people nowadays in the United Kingdom?
Well, what I would say is that there are incredibly diverse sets of housing options in later life, but that as societies we haven't invested heavily enough to develop a wider range of choices for older people who, for some reason, may be unable to continue living in the home that they would regard as the place where they'd like to continue to live until the end of their lives. So co-housing schemes, intergenerational house share arrangements, there are all sorts of creative housing developments that we should be investing in to increase the level of choice. But what we have at the moment is entirely inadequate. And just coming back briefly to the previous point is that we should also be optimistic in some way about the need to reform care settings. What we've seen in the UK has not been replicated in other countries around the world. So some countries seem to have done much better during the course of the pandemic in protecting people who live in institutional settings from the impacts of COVID. And what we really need to do is to think about what have other countries done so much better than countries like the United Kingdom or Canada, Belgium, and also what we hear about Spain.
What countries are doing especially better?
Can I just make one other point? I'm just going to make one. There is one practical point I would make on residential care and nursing home care, is that I think we should immediately introduce a system of monitoring rights or introducing a charter of rights to people in residential and nursing home care. And I would urge delegates to read a very interesting report from Amnesty International UK, which looks at the experience of this sector during COVID-19 and the abuse of many elderly people in residential homes. It has been an absolute scandal, and we need to set up a new system of monitoring and protecting people when they go into homes.
Yeah, well, there's definitely so much to do in housing solutions. Some other questions, we have them here in the audience, and there's also people writing, sending us questions from the YouTube channel, so let's go ahead, por favor.
Hola, buenos días. Yo me llamo Roberto y pertenezco a una asociación de jubilados de aquí, de Vizcaya. Mi pregunta es muy concreta. ¿Vosotros creéis que todos estos proyectos, iniciativas que se están realizando ahora por motivo del COVID, van a quedarse o en el momento que el COVID pase a ser un tipo, le tenemos medio controlado, pase a ser un tipo de gripe estacional y tal, todas estas cosas se van a relajar y vamos a seguir en una vida más o menos normal como teníamos anteriormente a esta pandemia? Muchas gracias.
Bueno, gracias a usted por esta pregunta. Es que justamente vamos a hablar en la siguiente mesa de esto, de cómo se pueden mantener, ¿no?, todas estas iniciativas fantásticas. The question of a man from the audience here in Bilbao is regarding all the projects that have become a reality for elder people to improve their life quality during the COVID-19 crisis. Are they here to stay? Because I guess that's what we are looking forward to. The question is for the three of you. Maybe I didn't translate it well. All the initiatives to improve the life quality of the elder people, well, nowadays, and especially during the lockdown, there has been a huge solidarity. So how can we maintain all these initiatives from now on?
I think that's an interesting question. The evidence from the UK, I think, is mixed. That right at the start, there was a lot of solidarity for different groups and neighbourhoods coming together. Now, as we've gone on, I think there's been some withdrawal from that. And certainly in some communities, there is a level of exhaustion, a level of fatigue, and amongst some groups, there are divisions between groups. So I think we have to be careful about this. I think, on the other hand, it has been evident, certainly in Manchester, as Paul, I'm sure, will confirm, that we've seen the development of various mutual aid organisations, people coming together in different ways. So the question is, will that be sustained? I think that will only be sustained if we invest more in our communities, particularly low-income communities, and invest more in community centres, invest more in people who can support those who are particularly vulnerable within communities. And I think invest more generally in resources within communities. So I don't think communities can do it on their own. I think if it's going to be sustained over the long term, they will need greater support. And I think this will be quite a challenge, given that the economies of many countries, certainly the UK, have been really battered by COVID-19. So we're going to be trying to sustain these activities in the context of an economy which has been severely affected.
Paul, Tom, do you have something to add to this answer, to Chris's answer?
Just a couple of things. We've also got the prospect of dealing with Brexit as well, which you know, from any point of view, really, I think for those of us in Greater Manchester, represents another economic challenge as well as all the other social challenges associated with it. I think one of the risks for us right now in the public sector is that people are just exhausted. So I think there has been, and it's right to make the point that there's been a huge mobilisation across public services, across communities, and in the private sector, to be fair, around keeping people safe and well and so on, keeping things ticking over. But I think, you know, once we start getting into next year, I can just see it from and hear it and feel it when talking to my colleagues, is that they feel like they need a rest at some point because it's been hugely demanding of them. I think the one thing that is critical for this work to continue and flourish and expand is all the things that Chris said in terms of investment, but additionally, I think investment in leadership by older people in the UK. You know, I think it's pretty weak here in the UK. The level and of older people's organisations, their ability to influence debates and discussions is very poor. So I think we need to do far more to give that group and those groups of people a voice in the decisions that are made in their services and the places in which they live.
Okay, and Tom?
Well, I agree, obviously, with what Chris and Paul have said in terms of their analysis here. I think what we need to really focus on going for the future is tackling the fundamental inequalities that really have been exposed by the COVID pandemic in terms of really negative outcomes for the poorest groups in society. So yes, we can invest in supporting the community initiatives that have emerged or become much more important over the course of the pandemic. But if that means investing in food banks and supporting food banks, then really you're not tackling the fundamental sources of disadvantage. It would be much better to make sure that people were not living on low incomes and becoming dependent on accessing food banks. So, so the trick there really is to harness the investment that people have wanted to make in supporting communities, but to push that into a different direction, with the state picking up the important task of providing incomes and reducing the inequalities that characterize our society.
Well, and one last question from the audience of our YouTube channel for Mr. Philipson, Professor Philipson. The question comes from Technalia. Well, we lost you actually, the video, but I hope you're still there, Professor Philipson. Do you have or know about any examples of how elder people can be involved in urban planning in cities?
That's a really good question, and I think that's really the next step for the age-friendly discussion. I think we have started to discuss this in Manchester, and the idea we've had, for example, we have a program of urban regeneration planned for part of Manchester, a very big community, 15,000 homes. And the City Council has been very committed to developing age-friendly principles in the development of that urban regeneration. And there's a research team from the university who've been writing reports about how urban regeneration can be made more age-friendly. There's also work in Newcastle upon Tyne, where Tom Sharp is, where again there's a big urban development which has involved age-friendly principles. So I think there's a good start here, and there are these examples. If you email me, I'm very happy to send further information about them. It is a challenge because we will need to involve private developers in this. I mean, the landscape of our cities is not determined by older people. It's not determined by the public sector. It's determined by private financiers and developers. And we need to bring them on board in terms of age-friendly design and urban design, and of course architects as well. That's a great question.
Well, so thank you very much. We don't have much more time for questions, but we really thank you for being with us, Chris, Tom, and Paul, and let's keep on working together not to lose the mobilization for elder people. In any case, before we go to the coffee break, because we really appreciate the comments of people around the world who are sharing this conference with us, Lourdes Bermejo is saying it's a wonderful conference, very important in order to refocus the thoughts and all the policies. So thank you for sharing. Eraberri Fisioterapia says thank you very much to the three of you and to the organizers for this conference. Very interesting issues and in order to make autocritic. So Jose Antonio Novo also says aging has two directions, from young to elder people and from elder people to the young people. And Lupe is saying that I highlight the initiative to involve elderly residents in friendly community projects. So thank you very much for all your comments. We are actually working all together today so that we can make friendlier cities and communities. So we thank you all. It's a coffee break and we will be back at 11:45, so in half an hour. Muchísimas gracias por vuestras aportaciones, and we hope to see you next time here in Bilbao. So. Café, volvemos a las 12 menos cuarto. La entrada y a la vuelta, por favor, debido a las restricciones de la COVID, que todos sabemos, nos tenemos que volver a sentar en la misma silla. Eskerrik asko, disfruta tu kafea eta zuek ere antzaudetenak YouTubetik. Gero arte.
Continue with this second half of our seminar, and there's something I must tell you, and that is that we are missing 4 headphones. So please, if you took them with you by mistake, please make sure you return them. So after witnessing and listening to the examples shared with us by our colleagues in the US, I'd like to introduce the participants of this second stretch of our seminar, of this second panel. On my left, we have Ricardo Anton, who's always a very interesting guy. He defines himself as an artist, as an ignorant, but as somebody who's very interested in placing life at the center of everything. You work in collaborative environments dealing with strategies and organizations. In your day-to-day, you move around the design of innovation processes, strategic consulting, and today you're going to be presenting what you've been doing since confinement in the put an end to this curve platform. And now I'd like to introduce you to a second speaker, Mr. Aitor Abesia from Zambrana. He is the Lord Mayor, and he's going to be speaking, the title of his presentation is Aging is not a synonym of losing quality of life, and its adaptation to the COVID-19 crisis. So, without further ado, let's hand the floor over to Ricardo Anton. I'm so excited, but also nervous to give a talk in front of a lot of people. It's been months. So, first of all, thank you very much for your invitation. I have come to talk to you about our initiative called Stop the Curve. I'm here because this is something that many people could tell us about. Curve in Spanish is curve like in a road, so brake before you reach the curve, but it's the bend. Okay, so thinking about the pandemic, right now we're obsessed with COVID, but perhaps the most important pandemic that that's been with us is that of an individual sort of way of doing things, this individualistic way of doing things. We somehow don't know how to collaborate, so therefore, if the virus is, we're learning from the virus, is it teaching us something? If it's teaching us something, I hope it will help us collaborate so that when we go back to normal, if we go back to a new reality, as they call it, I hope we'll still remember that things like not just facing the virus, but the rest of the challenges is something that we'll do in collaboration, by cooperating and helping each other. This is a project that was started by the government in Aragon. And a few days before we were confined, we said, well, something serious about to happen. They were thinking about the prestige and those oil leaks at sea, and they remembered what serious consequences this brought. And now they were saying, well, this is going to be different because this is going to be spilling over everybody's homes. People won't know what to do, stuck at home. So people from the government started to think about these things. They started to think together with other networks, and they started calling people. And so right from the start, this Stop the Curve is a project that many different stakeholders joined. It's not just governments from other autonomous regions. They called governments from other autonomous regions, but they also got in touch with associations, with people they held a relationship with, because the idea was to see how to involve everybody and come up with a melting pot, with a mix of different people. with different profiles. So that's one of the good things about this project. That is, together we're stronger sort of thing. So we need to do something about this, but let's see how we can do it together. The goal, the idea was the following. Okay, we have a situation and we're overwhelmed, and all of a sudden when we're all locked down with a new situation we'd never faced before, how are we going to do this? So we started thinking as to how to give way to collaborations in order to slow down the curve or to learn to live in lockdown, but through mutual support. So that was the first motivation that we saw in here. It's like an open platform that's built as we go. It's something. In the first 24 hours, one first web site was set up. Things went very fast. It was like nothing of what was happening was a perfect model, but it was a minimally viable model, something that's been improving, things that started becoming obsolete because they were replaced by newer things or improvements. Because since it's one of the first things that were set up, many people use this as a reference space. It's a platform with over 100,000 visits, and that's become a reference digital spaces in the midst of this situation. And it works as a matrix. It works as a matrix for many other experiences. So we start seeing initiatives starting in order to see how to support each other in confinement. So it's like a repository in order to try and learn from what others are doing, from what other initiatives are doing. So it became like a big repository with different tiers, with different social and citizens innovation initiatives. The project took a very important qualitative and quantitative leap, and you can see it on this map. Here you see something very important, and that is the initiative of a company that had already started working with this sort of free software that allows for replicability and for fast adaptation. Here, this brings together people who need help, people who can offer help, and intermediaries. A very important thing in the map is that it generated a great degree of replicability in other territories, in other countries. From different territories, whether they be large or small, through new technologies, this is something that started growing very quickly. So in very short time, our strategy became present in many other countries and many networks, especially mainly a Latin American one. Well, first of all, because of the language, and also because of prior relationships, people who were already working there and who were in touch with us. So the project, how can a project start working so quickly? Well, because there's a bunch of people who are involved through tools. Of course, we don't start thinking, well, we need to come up with some sort of flowchart. No, they're like emerging tasks that have to be carried out. It's true that, as usual, there are some nodes that are more active than other, but it's very easy to somehow join a project like this. There's a network made up by over 300 people who, through video calls, get together and start organizing themselves in order to see how to do things.
And other projects, well, in several days you get together to design other things or other actions. So it's taken us sometimes a month and a half, and it seems that all the things that happen there, it's like a lifetime, but it was only a month and a half. And the first round of projects has to do, in particular, with situations that had to do with the fact of being under lockdown or having to stop the curve. And many of these things had to do with, well, the manufacturing of masks. In other words, projects that were related to the lockdown situation and the pandemic. And then there was a second stage, and we were thinking about what was going to happen at a later stage. And these are the questions that were asked before. So we did another stage that was called joint challenges. And we tried to go for less emergent projects, and what we tried to do was recover those people that were already working on these projects in order to achieve continuity. And in these processes, we gave them support, and we developed another 363 projects in which more than 1,000 people were involved that became engaged in different manner in developing these projects. Let's take a look at some data. More than 500,000 people used the platform during those moments of lockdown only in Spain. And then what we did was carried out another activity, which was the festival Stop the Curve. I think that was on May the 2nd, that also wanted to give visibility to whatever had been done and how that had been done. And this was an activity that I think lasted 12 hours, if I'm not wrong. And this was watched by 14,000 people. And it's not that it was important for there to be 14,000 people watching, but I think that the interesting thing about this is that there were lots of people that felt engaged and committed in relation to what was going on there. So there was a sort of a community, a diffuse community around the project. And I think that that is something that is significant in this project. Well, many other things happened, and different spin-offs appeared. One that, well, just to situate you or to clarify things, we have these windows that join, and this was an initiative, well, that is based on the situation we saw of the people that are at nursing homes and how we can't be with them and how can we visit them. And sometimes the digital gaps were very deep. So there was a project that had to do with that, how to connect these people. And this, well, this is not based on a pre-planned idea, but it was devised by an engineer from Huesca called Alberto. And, well, based on the solution that he implemented to speak to his grandmother, because he gave her a tablet, and that's how they could connect. So if I've used that, why don't we do this with others? So through the Aragon government, which is the Laboratory for Citizens Innovation, the idea was to implement this together with his support. And that's how they managed to get 566 tablets with their own memory cards so that they can be used at 379 nursing homes. And that there was also a team of volunteers that provided technical and logistic support for that to be able to operate correctly. And they gave support to something like 28,000 users. And many minutes during which people can cover that digital gap. And there are many other projects too that have related to Stop the Curve. I think that Stop the Curve should be looked at as if it were a major catalyst of the many things that were happening, and what it was trying to do was well, push things along little by little or slowly so that things could work properly. And I could talk about more projects, but I'm afraid that I don't have enough time. So I'm going to focus on something else that happened during Stop the Curve. And when we set up common challenges, we thought that we were being overwhelmed by the emergency. So we didn't want the same thing to happen to us again. In previous occasions where there's a very big peak of solidarity and collaboration to address an emergency, but then in our daily lives, this became de-articulated. So in this project, a group of people that were thinking about this concern, well, we got together under what we call colaboratorio or co-laboratory. And it wasn't at that point in time, but how can we articulate the citizens' innovation ecosystem in a sustainable manner beyond emergencies? How can we make citizens' innovation be valued in life as something that belongs to our everyday existence? And let's say that this is something that we did for, well, I think it was 4 or 5 days we got together, and it's a process that is still maintained, it's still alive, and there are lots of stakeholders involved in Spain, and we want to know how to make ourselves visible, how to establish a map, and how can we make people understand what citizens' innovation means. And there's another side of things that has to do with building infrastructures and resources, because when Stop the Curve arose, we had to generate all of the infrastructures and see what people could contribute. So we thought, well, let's see if the next time we can organize things better, or let's see how we can use infrastructures over time. And here you have a link that connects to a manifest that says that now we have to support citizens' innovation. So it was this idea of how citizens and public issues have to find a greater correlation. And we talk about co-governance, but how do we co-govern ourselves, not only between institutions, but between the organized civil and non-organized civil society? And how can that be done? And this is one of the things that's one of the challenges, this new reality. How should we try to make things not be so disassociated between the public sphere and the citizens themselves? And these are some of the challenges that we've been working on that have to do with Stop the Curve. And this is something that Raúl has been working on, Raúl Olivan, who's working for the Aragon government. And it's interesting because they have brought together whatever has to do with social innovation and public innovation, and they are also dealing with volunteers. And I think that it's a very interesting mixture or blend, and they've presented something that they call the HIP, the Hexagon for Public Innovation, which has to do with institutions that learn. How can you transform the institutions we have that were created with this idea of upholding the well-being, the welfare state, when we can see that it's now not sustainable? And we have this Eurocentric approach to the state that says that this has to be turned around to see how we can sustain it. But, well, this HIP considers things that before Stopping the Curve were implicit but now have become more explicit, which has to do with thinking in an open manner and thinking about transdisciplinary issues. And we have to think about interconnections too, to do things quickly and in an agile manner and through prototypes. And before, when we spoke about the nursing homes, do they have to be cooperatives? I think that if we were to discuss this with the affected people, that would tell us how to do this in a collaborative manner with all of these stakeholders involved. And then there's a part that has to do with technologies that is related to how in Stop the Curve that was very important. Technologies, if they are open source, this means that the model has been able to expand, and technology should not be a gap, but rather something that opens up the possibilities of being connected. I'm running out of time, but I wanted to present some ideas, and I think that this could be very polemic in relation to what has happened to us. Well, this project of mutants and ponds, well, this is not developed by any kind of stakeholder, but rather, sorry, I was hitting the microphone there. What we have is stakeholders with very different characteristics, because the challenges we have are complex and they are multi-level, and we need to have this combination. This idea of using these prefixes so that what we have, isn't working. It's not working as well as it should, and we have to turn things around. So these prefixes, I think, can help us think in a completely different manner. And the same applies to this term innovation ecosystems. We are giving it names, and we're separating things, but what we have to do is bring them together. Perhaps something that I mentioned before that is essential is how to, by building silos, we can be specific about certain tasks. But let's say that being friendly, and when we spoke about friendly cities, well, this only covers part of the terrain. But if we think about being age-friendly for senior citizens, but if we then consider people with disabilities or women or migrants or just for people at large, we'd possibly create friendly cities. But what we are trying to do is find niches that we cannot connect to a sufficient degree. So this idea well, in my last minute, I have to put my mask on now that I've sprayed everybody with my breath. So if we have to give names to this, we talk about an open society, and we have to try to achieve the highest level of subsidiarity and the value of distributing things. I think that at the beginning I said I could be here, but it could be somebody else. And if there were a presentation in Granada, it could also happen. There's not only one person that can talk about stop the curve, but many. And the part of the things that I've said, I don't know how they were done because I was doing other things, but that happened, and that was just like magic. So distributed B2B network is a very important thing. Yes, I'm finishing now. So to finish very quickly now, trust, I think that is essential. This was implemented because there were trust networks that already existed, and this is why it was possible to activate them so quickly, and something that was explicit, that we knew how to articulate. And then we have diverse capitals. Each one of us has lots of things to contribute. We have to identify these things, and we have all the roles and capitals that are very important. And then, well, bringing together the different levels of governing and living. We've spoken about many things that have been by institutions, but what's important, what the neighbors have been doing with the networks that are set up to give out food. And then the importance of combining local and global things and the open source technologies that make it possible to extend this and replicate it. And I'm going to finish with Berria. We published a paper that I think summarized all of these key issues, how in a pandemic, what things had happened. So these are things that could be replicated, and I'm going to keep quiet, and I'm finishing here. So let's all do this together, and let's collaborate, and let's put an end to the virus, but not an end to our collaboration. Thank you. Thank you very much, Ricardo Anton. She's now speaking in Basque. I'm afraid that we have to wait until she speaks in Spanish.
Guzti hori azaltzeagatik eta hemendik aurrera, planteatzen zaizkigun galdera horiek mahai gainean jartzeagatik. Eta teknologia aipatu duzu, eta hain zuzen, orain Zanbranako alkateak azalduko digu nola teknologiari esker adineko jendearen bizitza erresten eta hobetzen ari diren herri txiki honetan, gainera herri txiki baten aldarrikapena egin nahi duzu, ezta? Aitor Abezia, zurea da hitza. Aitor Abezia, alcalde de Zambrana. Adelante.
Bueno, eso. Bueno, guztioi. Con mi compañero se ha comido la primera parte de la segunda. Ahí me queda el tiempo de descuento.
I've only got a few minutes left because my colleague spoke for longer than we all expected. But I'll be very brief. Zambrana is a municipality with 450 inhabitants. It's to the south of Álava. We are very small and we're very dispersed. And I was here to do away with many myths. And when we talk about a friendly city, it's something I don't like because it excludes us people that do not live in a city. I'd prefer to talk about friendly communities. And especially when we talk about active aging, our mind takes us to big cities and we forget about the countryside or the rural areas. So our project is all about aging, but that doesn't mean that you have to lose quality of life. What we saw, well, we are in a legal framework where we have the law on social services of Spain, and then we also had the decree that gave us an opportunity. It's a universal right to receive social services. But what we saw also is that there were users in our municipalities that were left outside that umbrella. And it was those citizens that had a 0 degree of dependence, and they required institutional help, but they were not covered by this legal framework umbrella. And that made us look into our citizens. So we took a target population. In other words, all the people over 65 years of age in Zambrana. It's older people mostly. In other words, youngsters of yesteryear. You have to be very positive in your terminology. So we tested all of these individuals, about 60% of them. And the picture, the snapshot, is what you can see in this chart. And in this chart, what we did was analyze 16 parameters of frailness factors. On the right-hand side, you can see that we have the services that were covered by, the benefits, nursing centers, home services, and those dots in the middle are our tested citizens. And as you can see, when they have a moderate degree of frailness, they access to the services that are offered by the decree. But what about those dots that are left outside the universal and subjective rights? What happens to those people when they're frail? Well, we had to work with them with an active policy that was very tailor-made in order to implement preventive actions and also to save in resources that were much more costly, like nursing homes or benefits. I can see Mariano saying yes to all of this. But anyway, and with this, we move into a world of competences, because you know that there are municipal competences or provincial council competences. I think that we have to separate these things, and we have to have a very clear framework. We have to work on prevention policies, on real active aging policies, tailor-made policies, and we are very reactive. Well, I thought that we were being very reactive in what has to do with me, with the political side of things. We spoke about financial muscle to implement these aging policies, but we arrived very late when the situation was very bad, when there was lots of personal drama involved. And this is why we thought that what we had to do is get out of our comfort zone, get out of the town council, and speak to the citizens before they come to us looking for solutions to their drama. And this meant that we created a multidisciplinary group where we had the family doctor of the village, the social worker, to go with a political agent and the cultural expert. So it's a multidisciplinary team that addressed all those issues. And I'm not going to say that this was an easy exercise, because you know that politicians stay in their comfort zone and the doctors also stay in their comfort zone, but they're very good at prevention. And the social worker says, no, we have some wonderful policies. But anyway, we must try to prevent any further degeneration from happening. So each one from our comfort zone had to set up a multidisciplinary group, and altogether what we had to do is set up personalized policies that operate in the field of prevention in our municipality. And I wanted to show you a video, as I don't want to speak to very much. The video, I think, is self-explanatory. Could you please play the video?
Sí, muy constantes. Al final eso, llevamos casi 2 años y hay gente que no ha fallado una semana.
Nos reunimos mensualmente para valorar las fichas que nos pasan las profesionales.
Envejecer no es sinónimo de perder de vida. Nosotros nos ubicamos en el sur de Araba. La población es tremendamente envejecida. Como el mayor síntoma del medio rural alavés es que tenemos la pirámide demográfica invertida. Vamos a crear un escenario en el que la administración se adelante a los acontecimientos, pasemos de ser reactivos a ser proactivos, a predecir lo que pueda pasar.
Casilda, ¿te apetece apuntarte a este programa?
Sí. Yo todo lo que me diga el alcalde lo haré.
Vamos a intentar que esa ciudadanía en situación prefrágil no se vuelvan con el tiempo frágiles.
Dicen que bueno, es duro, pero yo lo voy a hacer, lo voy a seguir intentando. Sí, muy constantes. Al final eso, llevamos casi 2 años y hay gente que no ha fallado una semana.
Nos reunimos mensualmente para valorar las fichas que nos pasan las profesionales de los talleres, viendo así la asistencia de los participantes, viendo cuáles han sido las cosas más significativas que ya se han visto de cada uno de ellos, y en base a eso pues vamos haciendo modificaciones o valorando qué va necesitando cada paciente.
Well, the guidelines we work on an in-person basis were the following. Venue, and we saw that there was a problem in the rural setting that especially was even more relevant in winter. There was lots of social isolation, and this had lots of medical implications. Antidepressants, that was one of the most prescribed drugs for those couples that had lost their spouse or their spouses. And we were concerned about that, because in summer the social panorama is much better, because you can go into your vegetable garden, you can go up into the hills and pick mushrooms, but when winter comes along the days become shorter, and there's a much higher degree of social isolation. It's cold and we go home or we stay at home, and this created a very powerful social isolation. So this is why we have this program that is a meeting point, and it's a space where the elderly people are who make the contribution and not the town council. And this meeting point is dynamized by one of the local agents, and well, this is where our youngsters of yesteryear become the main protagonists, and they are the ones that design a tourism program, and they show their heritage to the rest of the citizens. They are our local guides, and we wanted to develop a program to present Zambrana and the surrounding areas, so that these senior citizens can teach us younger people what the place is like. And then we have another program which has to do with population sensors. In other words, we give them a tool with a geolocation device, and they go out for a walk with it, and they come back to the town council. Well, look, there's a litter bin that is broken, and well, they send us the coordinates so that we can do something about it at the town council. And well, this was done on Tuesdays and Fridays. And then we have the part that has to do with physical stimulation. And all of those that form part of this program, what we do is make a customized assessment. I said, well, forget about maintenance, gymnastics. We are working with a physical training coach together with doctors. And what we do, we provide gymnastics. We also call that gymnastics, but we are really working on customized physical stimulation. Each one has their own file, and they follow physical patterns that are tested every year and are corrected every year too. We have very gratifying experiences. There was a man, for instance, who let go of his walking aid after 2 years of physical stimulation. And then we have the cognitive side of things, which is what I call is the memory workshop, because nobody likes to forget things, and that happens to me, and I'm 42, and nobody wants to be reminded that they're losing something, that we have to train the muscle, the brain. In other words, we work with a neuropsychologist, and what they do is, at the beginning, there was a group feedback, but what we noticed is that in that group feedback, the differences in terms of cognitive skills made them feel ashamed. So we then moved on to an individualized approach within the group, and in the final part of the session, it's a joint session where we share experiences. In other words, it's a social neuropsychological part. And this was done in person. So all of this, well, the pandemic came along and destroyed everything, and we had to adapt. And it's called Lagun Ikusiseña, which means invisible friend in Spanish. well, we couldn't do this in person. We couldn't do physical stimulation in person, and neither could we do cognitive stimulation. So what do we have to do? We have to adapt a technology to senior citizens. I'm here to defend or say something about the digital gap. I don't believe in the digital gap. It's something that we youngsters have invented to not provide our senior citizens with technology. You've seen Gasilda in the video, and she has a Skype account that is called Modern Grandmother. She's 92. And while she connects with Skype with the mayor of Zambrana, she calls me via Skype, and she appears on screen and said, "How are you, Gasilda?" "Well, I need such and such drugs." And she's the modern grandmother, aged 92. She has a Telegram account. I don't have one. Well, I have one now, thanks to her. And what do we have to do to incorporate technology at people's homes? Technology has to be invisible, because if not, well, they find that the mouse is very difficult to use. And what we do is use a program that has already been designed, which is Alexa, everybody knows, from Amazon. And we provide them with a tablet with audio, and that shows us the habits of each user. If you do not connect with Alexa in the morning, the social worker then issues alerts, because we are all very traditional. We get up at more or less at the same time of day. We connect with Alexa at a similar time. So they say good morning, and they ask for whatever they want. It could be the weather or news online, the weather in Zambrana. So this communication with Alexa is a friend, Alexa is a colleague, and Alexa is somebody that is compiling the daily habits of somebody. If somebody doesn't communicate with Alexa in a day, something's going wrong at that home. So this gives us feedback, and it sends an alert to the system we have at the town council. But then this system is very extensive, because you can also communicate with the family doctor via Skype or with a social worker. And we even include a weekly agenda of the town council activities that they like, and we even remind them about their drugs. And through Alexa, we can send them an agenda, and we tell, I don't know, Mr. Amancio, look, at 2 o'clock you have to take your blood pressure pill. Yes, that small blue pill you have. And now we are in a stage in which we want Alexa to identify pills or tablets. But then the most important thing is that all programs delivered online, and they are not able of connecting with YouTube to see these active aging programs that we're providing virtually. But through a program that is connected to Alexa, they're reminded that they have gymnastics at 4 o'clock in the afternoon. And that tablet automatically provides the exercises, and they do exercise, and you can't imagine how intense they are. And then, well, a voice can be heard, and at 4 o'clock it said, look, get your tomato cans and your Tetrabricks and do gymnastics or exercises at 4 o'clock in the afternoon. And this is also connected to a program called Naya, and we provide cognitive stimulation. And we provide cognitive stimulation with the tablet, but the tablet provides us with a lot of information. It gives us information on response times, on how they've progressed or how they've not progressed. So this is information that we're using via big data. And I don't want to say much more. Thank you very much. And that's all from me. So thank you.
Thank you very much, Aitor. Thank you very much for your very kind words, for your very interesting presentation.
Egiten ari zareten ahalegin guztiak gurekin konpartitzeagatik. Es el turno de...
And now it's time for questions for both our speakers in this panel. Any questions? Anybody? Anybody who would like to break the ice? Let's start with the people present here in the room. Are there any questions? Somebody please wait for the microphone.
Hola a vosotros, Aitor y a Ricardo. Una pregunta. Bueno, primero te voy a decir a ti, a Ricardo, que se me ha quedado corto el programa que tú traías, que realmente necesitaba mucho más tiempo para explicarlo y realmente cogerlo. Me ha parecido muy bueno, pero no te voy a hacer la misma pregunta que hice antes. Y a ti, Aitor, Solo una pregunta. En el equipo multidisciplinar, ¿cuántos mayores participan?
This multidisciplinary team, how many elderly people are there? I don't know, I guess my microphone fell off. Elderly people, there's older people, there's one person. It's a small group, there are 4 of us, okay? So, I don't know, this is something I've always been fighting for. Young people, what I find is terrible is that all programs for the elderly, all projects, all ideas, are done by young people without including or counting on older people. You still need 30 more years in order to have the experience we have, and in order for you to know what it is we need and not what you guys believe or think that we need. I'm always fighting here in all task forces. We need who work for and with the elderly need older people too in those task forces. Because there's the doctor, there's the manager, this and that, and experts on gerontology never show up when they actually know about the day-to-day things. I absolutely agree with you, but this committee is a follow-up committee. It's not a generation committee. It's a place for encounter. It's a blank space. We meet on Tuesdays and Fridays, and it's made up by them. Making visits is an idea that comes from the task force. All that feedback is gathered, but as regards the meeting place, well, this is generated by its components. And when we speak about cognitive or physical stimulation workshops, this is the result of the gathering of opinions from citizens. And all these things have to do with cognitive and physical things. Discussing this is discussing the objectivity of the big data that's been collected. So we shouldn't debate on whether we should do physical or cognitive rehab, because this responds to the analysis carried out by the population as a whole. And as regards programs, what you say is true, but it's also true that we have to say that the elderly, and I say the elderly, or my mother tells me that there's not just a third age, but there's a fourth age. So far, we've seen that they were receiving all the resources and all the care. And but they also need to start contributing. There's a program we call non-material heritage, and I am afraid that those things that haven't been written will be lost. I learned so many things from my grandfather, but unfortunately, grandchildren or the younger don't spend as many hours with their grandparents as I spent with my grandfather. I don't know, things have become much more technological, and I believe that this cultural transition should be performed or should be led by you, older guys, and you should also demand things from the town council, okay? Maria Jose Ramos says, I thought the arrival of Alexa in the homes, what's it doing to intimacy, to privacy? There's the there's the data protection law. When you bring Alexa, which is a loudspeaker that's always plugged in, or else its battery will run flat. It collects data. People who live on their own, who don't have a son or daughter or somebody, they need to give their consent in order for the social worker to connect with Alexa. And those who do have a family will, in that case, they will authorize their relatives, their children, their grandchildren, so an account has to be generated for Alexa. And this is linked to data protection law. And so obviously authorization must be given to relatives or to a carer or somebody from social services. And for Richie, well, there are several people who are saying that your presentation and your project means fresh air. But before you give your presentation, you and I were talking, and we were saying that these initiatives sometimes end up on a shelf, and they end up as isolated initiatives that are never interconnected, because major initiatives in our society must become involved in this social integration and this social interaction. The elderly need to become more involved. I believe that we all need to become more involved, and channels that will make this possible haven't been well established, because some routines we're accustomed to, that we're used to, and sometimes because of a series of problems we're facing, we realize that these channels need to be reconsidered, restructured, redesigned. Right now, we're speaking about the most useful technology, but this technology that's providing us with autonomy, with sovereignty, is taking away sovereignty from us and is going to Amazon or Google. So I know we're rushing, and we need to have this perspective to do things step by step and to celebrate each success, knowing that the structures, the infrastructure we have available in order for this to be possible is insufficient. So this five-pillar strategy, citizens' involvement, institutions, agents who need to have to do with research, with etc., etc. Everybody needs to participate. Right now, we are concerned with having them all around a table, but we need to take a step forward and make this be more familiar and to become a daily thing. The beginning I was saying, well, we need to be careful with gender issues, and right now, so I don't know, but we're starting to get used and to improve. But it's true that this is a task we have ahead of us, and we need to see it as if it were homework. Many things we're doing are great for public innovation, because of course we need to support everything public, but I believe we each have to make an effort in our own spheres. Any questions from the room? So from YouTube, with us to Ricardo. Are there initiatives coming or stemming from older people, from the elderly? Well, this is one of the lacks. Many people participated, but I think that, and here we go back to the digital gap. It's true that there may be fiction sort of thing to this, but another part is true. I know this was a very fast project. It came up quickly. I don't know, and perhaps we didn't have enough time to start bringing on board other people who were not present at the beginning. Well, things like with the thumbtacks, for example, people who want to participate, it's not so easy for them to reach them. So this is one of the challenges we have ahead of us. We need to have diverse projects, but sometimes they they somehow get stuck in the first or second loop of this project made up by loops. I'm in touch with people who unfortunately are too similar or too look too much like me. So we need to get in touch with different profiles, different people. Maybe someday you can visit Zambrana in order to see how they're taking down those loops. How have the elderly experienced this change from interpersonal relations to relations through social media or technology? I know that this is difficult. It's, for instance, a tablet. We all know that when there's a LED that all of us see a LED, it means that you need to plug it in because it's. And we've also realized that many people had fiber optics in their house because we said we're going to implement a system that runs with data. We realized that 50% have fiber in the homes. Well, it's true that the government's made a good job regarding connecting rural areas with fiber. It's reaching almost everywhere. There's a development plan that will reach everywhere eventually, and this is something that somehow positions us in the right place in order to communicate with others. So this development stage will be done with an invisible technology. Of course, if you want them to learn how to use a computer, to know when they're running low on battery, or that they need to do this and that. Obviously, this is something that needs to be done step by step. A good thing with technology is that it's scalable. They need to start with a small package and keep scaling up little by little. For others, will take more time, but well, you are showing us that we are making progress to improve mobility both in urban areas and in rural areas. So thank you, both of you, for sharing with us your experiences, and please remain with us because we're going to move on to other very interesting experiences as well.
Hain zuzen, jarraitu behar dugu, oraindik ere bi kasu inspiratzaile dauzkagu, eta horrexegatik aurten Euskadi Lagunkoiaren saria jaso dute. Eta oraintxe bertan aurkeztuko dizkizuegu, Gasteiztik eta Donostialdetik. Y bien, bueno, pues ahora vamos a ofrecer un par de charlas relámpago de la mano de las...
And now a couple of quick presentations from the initiatives that have been awarded this year with our prize. So we're going to introduce Sara Buesa Rodriguez, who's going to be sharing us their program called We're With You. She's and also Inara Solabarria, Managing Director of Nagusilan, platform or a program made up by volunteers. It's a telephone service, it's a line that has been set up in order to help people who are isolated. So, Sara, you have the floor. Welcome, and you can give your presentation either sitting down or you can, however. Well, thank you very much. And the first few words are being addressed in Basque, for which there's no interpretation.
ekimenak oso aberasgarria dira eta Gasteizko Udalaren zurekin gaude programa aurkeztu ahal izanagatik oso pozik nago. Decía que estoy muy...
I was saying that I'm very happy to be here with you today. I've found all the presentations extremely interesting, very inspiring, and it's an honor and a privilege to share with you all the work that we've been developing at Vitoria Town Council. In Vitoria, we share the vision that's been conveyed by Aitor regarding working in the prevention and active aging. So for the last few years, we've been developing a network made up by 15 centers for the elderly that has a series of services. Apart from the information service, they have health parks and a canteen network where we offer 600 meals on a daily basis. We offer courses and workshops that we run from the institution, but there's a whole bunch of self-managed activities. The elderly organize their budget, they organize activity. As I'm showing you some data here. We have over 35,000 people who are users of this network, and this amounts to 50% of people over 60 years of age. And we also try to develop our community programs, so work in coordination with different stakeholders in the area. All of a sudden came coronavirus, and on March 10th, day centers started being closed. On the 14th, the state of alarm was declared, as well as lockdown. And on the 17th, the canteen network also closed down. We had to reorganize the service, get in touch with everybody in order to see how to organize things, who needed meals to be home delivered. But there was a question, that is, how can we reinvent ourselves in order to keep on satisfying the needs of elderly people who were locked down, who were under lockdown. So we had a series of, we had an infrastructure, we had a professional team. We've about 90 professionals who work in these in these centers for the elderly. We have municipal technicians, and we've got people from the managing company, social cultural facilitators, monitors, and so we set up a telephone service, a line, 24/7. The idea was to get to know or to assess the situation of the elderly, to give them advice, to monitor, and also to detect possible vulnerability situations, loneliness, maybe people who didn't have family or social support, or people who were affected by the situation, and people who had found difficulties in order to satisfy their basic needs. In those cases, we switched on or activated different types of support. It had to do with home delivery, food or meals, buying, doing groceries, basic products, offering psychological support when needed, and also bringing them material for leisure. And we did this on a daily level, or every other day, or weekly, depending on the case. This is something we did in different stages. On March 18th, we started calling up older people who were users of our programs. of our existing program. We got in touch with them in order to see how they were doing. In March, we came up with a sort of a script in order to organize and run interviews. We trained people who were in charge of making the phone calls and to teach them what to say, how to do things. And we also started gathering data and analyzing those data gathered, calling people who were living on their own, alone, without any social support. So we used our census in order to detect those possible cases. At the beginning of April, we took a further step, and that is to set up 2 further lines, telephone lines, and we came up with information brochure, and we kept calling them up, etc. First of all, those who lived alone, and we also started, and then we started calling married couples, couples who were, I don't know, in the 60s, 70s. Then we said, which shops are open during lockdown? Well, pharmacies, bakeries. I started going to these places in order to give them brochures. This is from my street. Bakers. And once this system started operating, we started adding other things. We started getting in touch with different radio stations, and we also started organizing radio programs from homes. So we, and apart from this, we set up a YouTube channel so that centers started broadcasting physical exercise activities that were broadcast. Of course, they were recorded. Then, as soon as we could, on June 15th, we started opening up canteens again. Then the state of alarm ended, and we started sending people to workshops, people we were monitoring. In August, there were still 180 people under monitoring. Elderly ladies, especially of 70-some, 80 years of age, living on their own. So some of these lines are still active. And as we see things, this is a service that's been very successful because we believe we've been able to respond quickly to the needs of many of these people. We've reached out to 11,500 people who were in serious needs of support. We've activated 150 home delivery meal services. In some cases, we've brought material for leisure to their homes. And the perception by the elderly is that our service is a good service. I found it extremely useful. But I must say that we've kept updating material. Right now we are in a project mapping the different strategies and initiatives that were deployed during confinement in order to detect lacks and things that could be improved. So that's a very quick summary of what we do. Thank you very much for sharing this program with you called We're With You. You're Not Alone. Okay, with 3,000 euros in order to visit a place in Europe where you could find inspiration regarding age friendliness. Which place, where would you like to go? I don't know. There are several places. We need to see, have to see and decide. Well, maybe Manchester. Why not? And also in this edition is a program called Hilo de Plata that's also been awarded with a prize. And you have the floor.
Initial remarks are being made in Basque.
Oso garrantzitsua da, voluntarioetzatik lan egiten dugunontzat, esfortzu asko dagoelako proiektu guztien atzetik, eta holako errekonozimendu bat asko suposatzen duelako proiektu honen atzean lan egiten ari diren pertsona nagusi guztientzat. Eta hori esan da, noa pizka bat azaltzera, zer dan ilarrezko aria proiektua, proiektu zar bat delako, baina egokitu egin behar izan dugu urtengo egoerara.
What I was saying in Basque now is thank you very much for allowing me to present this project called Hilo de Plata, or Silver Thread. And it's a recognition that is very important for all of the people that are working, the volunteers that are working in this project, because they are making a significant effort, and that involves many hours of work in solidarity with senior citizens that are in difficult circumstances or situations. But firstly, I would like to explain what this project is all about. It's from Nagusilan. This was born 25 years ago, in particular in San Sebastian, and it was produced by a number of people that knew about the volunteer experiences in the United States of retired people there. And they brought their experiences here to assist elderly people that were living alone. So they saw that there were many people in this situation, and they started to develop volunteer activities of different kinds and in different fields, because they started to provide support at nursing homes on an individual basis, and they also did this at day centers and at homes. And in this task and in this support at home, you can see that it's not always easy. It's not as easy as saying, okay, well, let's provide support for people at home, because they came across a reality, and that is that many of the people that are living alone are living in the rural areas where sometimes it's not easy to get there. And there are lots of people that are living alone in dwellings that are hardly accessible. And there is also a reluctance, or there's a difficulty sometimes of opening up our door, our space, which is our private space. So opening your door to somebody that's unknown or somebody that is new is not that easy. So what they did was design a new project that is called Hilo de Plata, or Silver Thread. But how could we overcome these difficulties? And what they did was devise support via telephones. In other words, with the telephone, you can reach out to many more people. You can also reach out to many more homes and more rural areas. And in other words, take a shortcut as regards accessing lots of homes. And what they did was set up a 900 line, telephone line, for all the people, elderly people that feel that are alone can call in. But how was this organized at the beginning? This was born in the year 2000, so it's been around for 20 years. And well, what they did was we did this at the La Roussillane premises, where the call center was set up, and well, people discovered it, and people started to call in to have a chat. And the goal was, well, those issues or those conversations that could be held that we have with our friends or with our family, or those people that do not have friends or family, so that they can speak to somebody and to supplement other psychological support services or meet other needs. And also with a certain amount of specificity, in other words, so that, well, they don't only call in, but we call them. And once they access the service, they are allocated a volunteer, and they always speak to the same volunteer. And it's the volunteer that calls them up in a certain time frame during the week. And let's say that they do is set up a relationship, and it's not only about volunteer activity, so they get to know each other and they start to create other kinds of links. So 2020 came along with COVID, and all of a sudden La Roussillane came across a twofold challenge. The challenge of what's going to happen to these people that are living alone at this moment of lockdown. Before, if they were living alone, and now with the lockdown, the feeling of being lonely became even worse, because they have less possibilities of going out. And those people that perhaps did not have that feeling of being so alone because they had their routines when they went outside to go to the supermarket or go and see their family doctor, whatever, they suddenly were locked down too, and they started to feel lonely. So in other words, the feeling of loneliness grew exponentially among senior citizens, especially those that don't have a social or family network, and whose everyday life is related to their daily routine that is completely upset or disturbed. And apart from the concern we had for these people, we had a concern about our volunteers, because they are also senior citizens and they are equally vulnerable to the pandemic. So we have loads of volunteers that are used to carrying out these activities and in providing home support. So we thought about this, and we thought, okay, well, we have a resource that is perfectly adapted to the situation, which is to provide telephone support. But how can we adapt this technically to this situation and activate all of these volunteers that are willing to do something, so that they can get in touch with these other senior citizens that feel lonely and that need to have some kind of support that many times is only about talking to somebody for a while and filling up those long hours in the afternoon that have been very boring for everybody. But if you don't have family support, it's even worse. It's even worse, rather. So what we did very quickly, we said, okay, what shall we do, or how can we do this? Well, we had to overcome a technical issue that was relevant, and that is the method we used in the past of having a telephone exchange, of receiving and making calls, was of no use because everybody was at home. So what we did is see technically how this could be done, so that these volunteers could call in to the people that needed them, and well, with the issue of data protection and confidentiality too, so it wasn't a straightforward issue. But at the end of the day, we did find a solution to place hidden calls and be able to reach out to all of these volunteers. And we also adapted the issue of training, because lots of volunteers had already received training and they had previous experience in accompanying or supporting. But many new people wanted to provide this support, but they had to be trained first. And orientations had to be given, so how they were supposed to make those calls technically, and for the whole thing to be effective. And then what is essential is to coordinate ourselves with other services, because we saw that it was absolutely complementary to other services, and that we had to coordinate everybody to meet everybody's needs. And we were there to accompany people that were living on their own, and there are other services to provide coverage of basic requirements like food, for instance. And then one of the most complicated things was to reach out to those people that felt they were alone. Because in this collective of senior citizens, the people that were loneliest were those that were less involved in the networks, or those people that connected less to the internet. So we had to reach out to them through traditional channels, more traditional channels. So we then carried out a campaign, and first of all, we did it with professionals with other resources that were accompanying elderly people in other areas by the issue of food or cleaning or whatever. And then, the traditional systems like the radio or the press, and we knew that they could reach out to these people that were living in a more isolated manner. So we joined the Laguna Artea network, and what we did, many people were calling in, and they said, okay, look, if you have this need, let's join Guztion Artean so that the Red Cross can give us a helping hand. Because if you need psychological help, apart from conversation, we had the Association of Psychologists also involved. And another of the most important things of this project is that it be the volunteers themselves that became involved and said, okay, if we want to do something, we have to make it technically feasible. We don't want to stay at home. We know that we are old people, that we are vulnerable. We know that we cannot do certain volunteer activities in person because that poses a risk for us, but we want to do something from home because we are okay, and because we also need to play an active role in terms of collaborating with these people and in developing solidarity to cope with this virus. And then we have calls from other bodies and other communities that were very important too when the time came to disseminate what we were doing. And then the issue of making ourselves known, the volunteers participated in this, and another positive action that was generated was the high degree of solidarity. And we were not only called up by people to have a conversation, but we were called up by many other people to offer themselves as volunteers, and companies offering their staff so that they could also make telephone calls, and professionals from the field of psychology. So we couldn't involve everybody, all of those people that were willing to call these elderly people that were living alone at home just to have a pleasant conversation with them. And, we activated the Nagusilan volunteer movement, and then little by little we incorporated more people from other spheres. So in-person training became online training through presentations, and we gave them some training materials. And then another of the issues that was very important was to extend how these people could access the system. Before we had the 900 line, telephone line, and we set up other pathways like WhatsApp and email. And the ultimate goal was that it be very easy to access through as many channels as possible, and that nobody be left outside. The goal, we wanted to support elderly people that were living alone through telephone conversations, but we also wanted to activate these senior citizens that wanted to become volunteers to provide support and feel useful in this solidarity network that was set up. So another of the important things was networking. And without networking, it wouldn't have been possible to give support to so many people, and that is the work with the social services or with the health care services. And it was through the telephone calls that they managed to identify what kinds of needs senior citizens had, and how you could see that many of the senior citizens that were calling in needed to speak to somebody. They needed to hold a conversation and tell them what kind of experience they were having and what they were feeling. And the number of calls placed were, it was nearly 5,500. It was 63 volunteers that were in charge of the telephone from Monday to Sunday, calling people up and holding all sorts of conversations with them. So each person spoke about whatever they felt like speaking, and it was more than 12,000 hours of volunteer work. In the case of the people that participated in this exercise. And then goals achieved. Well, it's been very important to demonstrate that we have been able to say, look, we have to give a quick response. This is required by the situation, and by organizing ourselves properly, we've been able to meet a need that our volunteers and our assisted people had, because we set up WhatsApp groups to give support to our volunteers who were equally old people, and they were under lockdown, and they felt alone too, because they'd stopped doing their daily activities because of the lockdown. So networking has been extremely important, and we've demonstrated to ourselves that we can operate in different sectors together, and that this coordination produces some excellent results. And it's been more than 24 social services and the volunteer agencies, foundations, healthcare centers, companies. And thanks to the volunteers, there was a very big impact. And, well, nearly 550 applications were received in 3 months. This is the new image that Hilo de Plata is going to have, and with the new system, what we're going to do is extend it. So this is what the situation has brought about, and that is a new organization for the project, which we wanted to reach out to many more people. And then evaluation. Well, it's been very important because we carried out an evaluation in summer on the people that we've given support through the program, and there was a very high degree of satisfaction. And, well, the outcomes have shown that many of the people that we started to give support to during the lockdown and stayed with the project. They want to continue with these conversations. And then as far as the volunteers are concerned, in the workshops we held, well, the most important thing, what they found was most important, or what they underscored, is the feeling of being useful and of doing away with that stigma of being older people. No, but they've been able to achieve their objectives and to remain active through telephone calls. And very quickly now, just to finish off, there's been a very significant social impact, and it's a project that is very straightforward, but we believe that it's definitely worth it, that it can provide plenty of support to many people. And that's it for me. Thank you very much. End of the presentation. Comments are now being made in Basque again, so we'll have to wait until they say this in Spanish.
Batez ere, beraiek aipatu egin dutena, ez? Azkenean, etxean egotea eta ikustea ezin dutela hasiera egin, beraientzat oso gogorra izan da. Batez ere, ohitura, boluntariotza lanetan ibiltzen ohitura daukaten pertsona horientzat. Beraz, satisfazioa beraientzat izan da itzela, eta horretan jarraitu nahi dute. Azkenean, nagusia dira eta asko daukate erakusteko eta egiteko gizarte honetan. Batez ere, beste batzuei laguntzen.
Hablamos de la importancia o del valor.
We're talking about the importance of this program. It doesn't only benefit the people that receive the telephone call, but also the people that offer this support. We are receiving congratulations from the people that are following us via YouTube.
Hemen dagoen publikotik edo YouTubetik ere, batean bat badaukagu, pero empezamos con posibles preguntas.
Okay, so we will kick off now with any questions in the room or from the room. Hello, good morning. Thank you very much to both of you for explaining your programs, which I found interesting. What I would like to say is that what I believe that is Nagusilan, and I think that you are doing some wonderful work there. I think that this is something that should be taken on board by the public administration, and in particular, well, they are in part doing this, because you've been talking about the telephone calls, the supporting telephone calls from senior citizens. But I don't know. I know that you are assisting the institutions or supplementing the institutions, and I'm not sure if that is positive or not. Does that mean that the public institutions are no longer doing this kind of activity? Because in Portugalete, in the Portugalete Town Council, and last year before COVID, it was deemed necessary that, well, it was seen that rather that social services didn't have this or didn't offer this kind of support. And I remembered you at that point in time. And they said to me, well, in Portugalete, we don't have Nagusilan nor anybody else. So they set up a group in social services. And yes, they also included, when they asked for volunteers, and they managed to set up a group made up of 30 people, 30 volunteers that assisted municipal social services. Because at this point in time, calling up senior citizens, if you don't say that you're from the town council, or if you do say that you are from the town council, they don't trust you. And I think that it would be, and it's not because I'm from Portugalete, of all places, but I think that it would be much more interesting for the municipal services to be supported by people like you. I think that would be far more interesting. Well, yes, what we try to do is supplement what other people are doing, but in any case, what we believe is the public authorities have constraints because there are economic constraints and there are limitations in terms of capabilities too. But what we want to do is hold conversations. We want to be a friendly voice. We want to be somebody with whom, well, they could meet up one day to have a cup of coffee and let's have a chat. Because we understand that this is something that cannot be covered by the public administration. Yes, of course, you can place monitoring calls and you could also call them up from time to see how things are going. But all this business about let's talk about whatever you want to talk about every week for a couple of hours. I don't know, we can talk about your hobbies or what you've seen on the television, if you're concerned about your family, if you're not concerned, or if you have a noisy neighbor or whatever. That cannot be covered. And what we can see is that people need just that. People need to speak and to be listened to. And to do that, what you need to have a social network. And many people cannot have that. Well, the family members and friends or neighbors can't have that. But you can't. It can't be somebody from the administration that calls us up to talk to us without any time limitations. This has to be done from the community. And what age groups are we talking about? This is a question from Gabriela Gomez. So what sort of age groups did the volunteers belong to? Well, this depends to a certain extent. We try to connect with people that have more affinity. So what we do, we work as an intermediation. We play an intermediation. Or there are people that prefer to speak to a man or to a woman, or there are people that are closest to their municipality, or perhaps they prefer to speak to people that are living further away. So age groups can vary. I don't know. It depends. So what kind of ages were there in terms of volunteers? This is the question from Gabriela. Well, right now in the COVID situation, young people, people of all age groups, we do give priority to senior citizens because this is the volunteer activity that has been carried out by older people. We're talking about older people. Well, we say that it's normally over 82 at Nagusilan, and the rest of them are youngsters or still young people. And above all, we prioritize as from age 60. But in any case, there have been people that from all ages that have volunteered, but especially it's women that offer to call. What about men? How can they do something about this? Well, yes, it's mostly women in relation to volunteers, and it's true that loneliness, as from a certain age, you know that it's women that feel lonelier, because loneliness in men appears at a much later stage, as from 70 many years when they become widowers or when their health situation worsens. It appears earlier in women. So I think that emotionally speaking, they are also able to express or to voice the fact that they need company, or because they are on their own, because they feel very lonely. And then women, well, also become much more involved in emotional issues and in care issues. And they will always feel much more encouraged to work as volunteers, much more than men do. But in any case, we have men involved too, and they have to be helped so that they can do something in this sphere, so that they can become volunteers. Any more questions, please? I would like to thank you. I would like to thank both of you for having presented both proposals, and I think that this reflects perfectly well what you're doing, how you're supplementing or helping the public administration. But I would like to ask Sara this, because you said that this was also focused on the psychological sphere. Well, on the one hand, I think that it's wonderful to see, and it's very positive to see that we professionals, or you professionals, are capable of being so resilient. So if the situation changes, we will change what we do. And we are criticized about, and I think that they're right, is that citizens that have to come to our homes. But I think that this proves that no, that the administration can also adapt. But it's funny to see that there were people, or there are people, that do not only require psychological support, but also something that has to do with mental health. And I'm not sure if you've been able to make any progress in that regard, because I suppose that you have come across people that perhaps specifically needed a different kind of support, or more support. Well, yes, what I mentioned about psychological support, and as you pointed out quite rightly, in this situation, perhaps we've been much more agile and much more resilient, because we've involved the administration, and this has taught us many things. Because what we made available all the programs we had. So psychological support was under another program, which is a support program for caring families. So we had psychological support with psychosocial formulas. So the psychologist was dealing with the situations that perhaps required support, because emotionally they were in a complex situation. But apart from that, there's also been a very close cooperation, because when we saw that there were cases that could perhaps require other kinds of support in terms of social services, or I don't know, when we had to assess other kinds of situations, we had to resort to the social services, and also in coordination with other systems. From the point of view of health services, mental health services, and we had to coordinate ourselves with the NHS, because it is true that this device that we set up, the people that were calling in were not strictly the base social services, but the fact that we were together in the same department, well, everything was perfectly set up. So we had a script, and we also had how to deal with these situations, and you had to go through a more customized system, and you had to establish a much more in-depth relationship. Question now in Basque.
Elena Martínez, bidaltzen dizu, nola kudeatuko da proposamen berriak aurrera eramateko komentatu duzun hiritar laborategia? ¿Cómo se va a gestionar este laboratorio?
How are you going to manage this citizens' laboratory to be able to implement new proposals? Well, this is something that I mentioned very quickly towards the end, because I find that it's interesting, and I also agree with what Endara was saying. We are very complementary, what we can do from the administration and what you guys can do from Nagusilan, or even now, in the case of the pandemic, we have a supporting citizens network that have done some very interesting things. So in a way, the feeling we have is that lots of interesting things have been done, but we have to coordinate ourselves better. So this is why we need to establish a map of what's happened during COVID. And we've invited people in Vitoria, we've invited all the platforms to come along, because we know that they have implemented lots of actions during the COVID pandemic, so that we can discuss what we've done and establish a map graphically and visually, and then with those very people and with some other people, we should see or carry out a discussion and to see what can be done, and see what kinds of gaps there are, and see what kinds of ideas that could crop up. And that's going to be done in the month of January. It's Basque again.
koordinaziorako eta elkarlanerako deiak beraz, nik uste dut hauek direla, mezu nagusiak hemendik aurrera egin beharreko lanaren inguruan. O sea que con estos mensajes tan claros sobre todo.
Okay, well, these are very clear messages that have to do with collaboration and cooperation from the early stages. This should be like the guidelines as regards the future, so that we work in different areas, cities and towns and rural areas. And I'm going to stop here. And now it's Mariano Olavarreta's turn, who's going to close this seminar, and he'll be starting off with the awards giving ceremony. I'm not sure if the winners themselves are going to collect their awards here on best practices of Euskadi Lagun Koyak of the year 2020. So, Marian, I'm going to say goodbye, and I'll leave this in your hands, and congratulations, and thank you very much. You've been a big inspiration for all of us.
Bueno, egunon denorik, lo primero...
Good afternoon. We're not going to be giving the awards, but rather you will be picking them up. We've had 12 very well-designed projects, especially considering the situation in which we are, and so 12 projects, 6 from Biscay, 3 from Gipuzkoa, 1 from Álava, and 1 from Spain. In any case, would like to thank you all for running for this award. The first award is for Ausilan, and so José Luis Elosu, who will be receiving it and picking it up from the table here.
Joaquín, que lo cojan. Joaquín.
Bueno, nik noski eskerrak eman nahi ditut. Lehenbiziko, Eusko Jaurlaritzari, nola ez ba?
These thanking words are being addressed in Basque.
Bi motibo dauzkan iritziz fundamentalak. Batetik da boluntarioak animatzea, eta bestetik ikusi deu da gaur erremita hau, Hilo de Platako erremita hau oso baliozua dela, eta ez konturatu baina arte horren baliozua danik, horren baliozua danik oaingo COVID hau azaldu arte. Hor konturatu gea, da gaula erremita oso ona. Horregatik, gehien bat eskerrik asko. Decía que muchas gracias.
Saying thank you very much. I'd like to thank the Basque government for giving us this award. For 2 reasons, not because it's been awarded to Ausilan, but because somehow it highlights a wonderful tool we have, which is Hilo de Plata. And this is something that we've seen clearly with the COVID situation. So what we've done is not enough. It doesn't suffice. Rather, we need to keep on developing this tool. Thank you.
Eskerrik asko. Bueno,
thank you.
Vale, y por parte del Ayuntamiento de Vitoria-Gasteiz.
And from Vitoria Town Council, Sarah is going to be receiving the award. Congratulations.
Gasteizko udalaren gizarte zerbitzuen izenean, bi hotzez, eskerrak ematen ditut Euskadi Lagunko Jasari horengatik. Iaz, akzesita jaso genuen Piztu zure auzoa programagatik, eta aurten etorri da saria, bai. Ilusio handia sortzen digu, eta motivazio injekzio handi bat da gure lanarekin jarraitzeko bide honean gaudela adierazten digu, bai. Decía que...
I was saying that on behalf of the Town Council in Vitoria, I'd like to receive this award. Very moved, very proud, and it's always nice to see how people appreciate what we do, especially taking into account the wonderful job that's being done by different teams who work with the elderly. So this is dedicated to all of them, and I'm also referring to all professionals as a whole, because their job is not always visible. Pandemics has been test. Hasn't been and is not being easy to handle the pandemic. We're trying to do our best. Of course, some things could have done better, but we are trying to work responsibly, taking into account the important role we must play as social service providers in order to help the more vulnerable, in order to prevent and I guess we've been able to reinvent ourselves. We've worked in a flexible and agile manner, but we've always thought that we were doing the right things. So I feel very proud to be a part of these social services. So I'd like to thank all professionals who make up this service. These services. It's a wonderful motivation, and we believe that this is the path we need to follow in the future. Thank you.
Bueno, yo creo que ya vamos acabando.
Okay, we are concluding. I think that friendliness is something that's been at the core of everything we've addressed. We've spoken about friendly towns, friendly cities, friendly communities. You've done some wonderful work, but there is still a lot to be done. I'd like to thank the organizers who've made a huge effort in order to organize everything and make sure that everything would run well. I'd also like to thank our chairperson, who's also very much involved in this area. So I'd like to thank the different speakers, everybody present here and through YouTube. Please take care of yourselves so that we can get together physically tomorrow. And here we are, and if you need anything from us, you know where to find us. Thank you.